to my quilt.
Emotional comfort dog in place.
Exactly, a service dog.
A service miniature horse. I don't know. I think in theory we are live. Let me take a look at YouTube. It still says waiting. Oh, I think we're
live.
Actually live.
We've been live for 20 seconds.
Okay. All right. So we are here tonight to have a not particularly good time talking about something really horrible. And we have an outline that we're going to work against to try to be a bit organized because there's a lot to cover. With me, there's a number of people that I have actually asked to join us who may stop in later because this was very last minute putting it all together. But with me, we have Skeptalk.
Hi, everybody.
And Prospero.
Hello.
And I think we haven't had a good pandemic in a long time, certainly not one that most people alive can remember. So
are there good pandemics?
No, there are no good pandemics. But normally when we have a health crisis, even something as terrible as polio, we don't really run out of iron lungs. The main concern is not that this particular virus is so horrible that it's going to just kill a lot of people outright. What we're worried about is that it's so contagious, it's going to overwhelm the healthcare system and create shortages of things so people can't get the care that they actually need, thereby driving up the death rate. And obviously no one wants to see that. So we just want to talk a little bit about what the coronavirus is, and then talk a bit about how governments and businesses should try to address some of these things, because there's an awful lot of moral questions. How do you want to attack this? If you say that life is precious and it's the most important thing, well, okay, that's interesting. And then if you take a utilitarian approach, that's interesting too. And there may be some trade-offs between these different types of things as we look at the specific issues involved. But we're going to try to be very systematic and follow the outline. And if all of that doesn't end up happening, I guess that it is what it is. But we're going to try. So I've started, just to sort of introduce things, describing what the coronavirus is. It's a form of SARS, and it's extremely transmissible. And the main problem is that within the population, there is no immunity that we currently have because it's a brand new virus. It is a novel virus. And normally, if there was a flu and previous generations had that flu, they would have learned immunity to that, or at least some amount of resistance, because their body would know that in the identify friend or foe structure of microbes and viruses, that this is something that they should respond to. When this thing hits a human body now, the body doesn't know what to do. In fact, it doesn't even really realize it's being attacked for a while. It looks like, I talk about the R0 value or R naught, and that is generally how many people each infected person passes the disease on to. Now, China numbers are not particularly reliable, but it looks like every person in China gave it to 3 other people. That's more than the flu by far, and it's a lot less than something like measles, where the number is usually 10.
I have a comment about that. If
go right ahead,
interested in me jumping in, here's the problem, or not. It's not a problem. It's just a characteristic of the R0 transmission rate. It's an arithmetic mean, which means that it's essentially an average. But the R0, the effective R0, is going to be different in Shanghai than it is in rural Wyoming. Okay, it's going to have to do with how many people you come in contact with every day. And so I almost think that you are going to have a much slower spread in less densely populated areas than you will in very, very densely populated areas. And that you probably have to address, the most important place you have to address this is in those congested areas. It's much more important to have vaccines when they become available, and it looks like they're going to start to become available here shortly. Have those distributed into the areas where you would expect R0 to be higher than, the proverbial out there in the big sky country of Montana.
Yeah, and there's also the issue with China's reportage. We don't know whether we can trust the numbers from China.
We can't,
because the population density and by the way, I think Sniper's here. The Chinese aren't going to give us good numbers. We're going to get better numbers out of Italy. And God, was it Indonesia, Harry?
Indonesia's also got it.
Okay, they're going to
Korea.
And South Korea. They are going to be much more willing to share information with World Health.
It's going to be better quality information.
Yes, and they're not going to be all American CDC, screw you, or the attitude China had toward the WHO or the CDC. And once we can get those numbers out of places that don't have some idiotic reason to save face over a fucking virus, pardon my French, you're gonna have a better R naught value. You're also going to have a slightly better grip on the viability of the virus on surfaces for what the period of time is. It appears right now that it's about 2 weeks on solid surface that has not been sterilized. I mean, there have been rumors of 28 days. There have been rumors of, that it's so much of an exponential over the SARS we know. I await that information for the really solid calculation.
A lot of this is going to be about waiting for information. I think you hit it exactly on the head. When we look at the breakdown, this is farther down in your outline, but it's a little bit relevant to what we're talking about here, where it says 80% not life-threatening, 20% requiring medical care, and death rate of between 0.1 and 2%. The fact of this thing is, and I had a disagreement with somebody about this on the last stream, is I don't actually think that this is going to kill millions and millions of people, particularly if we get a vaccine in place in short order. And it looks like at least one Israeli company has come up with a very promising looking vaccine that they think they can have tested and ready for human consumption within 3 weeks.
Really?
Yeah.
That's a short run on tests. And are we going to...
Oh, yeah. It absolutely is. Would be an emergency style thing, basically just going all the way around everything.
Will the FDA be told to stand down?
I don't know the answer to that.
There's several vaccines in progress, and also the sources I've seen that seem the most credible seem to think that we almost certainly will not have a vaccine until next year. So essentially, it'll be added in with next year's flu season.
If it goes through the FDA process, that's absolutely true.
I think even the accelerated process it's going to take now.
In other countries, though, if there's an efficacy, if efficacy is demonstrated, and it's going to have to be demonstrated in some place like Israel, not Iran, because their medical protocols are all fucking.
Iran is denying that it even exists, and they're saying it's tuberculosis, and they're treating it with corticosteroids.
Yeah,
but and that's bad.
If
a bad thing.
Let's say the government of Italy says, forget the normal protocols. We're going to, in and around Vicenza, where we have an outbreak, we're going to. It's purely voluntary first go round, right? Test There may be human guinea pigs. People willing
We'll
to be
save a little powder for later, Prospero. We're
okay.
just framing. We're just framing things right now. And
No,
we're doing
no.
a very
I
good
was
job of it.
I was just talking about the potentiality of a vaccine sooner, and people leaving off protocol. Because remember, penicillin went into play. In military use before it went into play in public use, out of sheer freaking necessity.
Because there was a war.
Yeah, because out of sheer freaking necessity.
Right.
And
yeah.
And so that efficacy was proved in the non-FDA manner.
Sulfonamides also.
Yeah. I
Yeah.
mean, so I know I'll save my powder.
But I will say that I don't expect to see a vaccine just based on the experts that I've looked at. And I did do some homework here without this becoming too dry with a bunch of citations. But I do expect, and this is just an educated guess on my part, that we may see effective treatments much sooner than that. There are over 100 trials taking place in China right now to try to double-blind trials to try to determine what existing things we have might be useful, including some extremely potent antivirals. So we may see something that lowers the death rate and makes it less dangerous sooner. And of course, the less dangerous it is, the less draconian the measures are that we have to introduce. It shifts that whole balance we're going to talk about in a little bit. And it looks like Sniper's joined us. Did you fix your audio?
Audio wasn't the issue, to be honest with you.
Okay, it was your children. Got it.
No, for whatever reason, and I wound up. I'm out in the truck on the phone. For whatever reason, the second I tried to put in the logo, it lost its mind and just refused to behave itself after that. And then on my phone, the only logo I had was the Christmas one. So you might notice I'm Christmas Sniper.
Well, you might notice I have no logo at all, so I'm not in a position to criticize anybody. So let's move on forward because I don't want us to get too bogged down. Go ahead.
I had a comment, and I don't know if you guys have addressed it while I've been fighting this darn thing to get me in here, but the mortality rates. The reality is we have no idea what the mortality rates are.
Correct.
Because everybody who has mortality rates is lying about it so far. So we really don't know.
I don't think everybody.
I think China
China has certainly lied, but who else has lied?
Iran has as well. As you pointed out, they're saying it's TB.
Right.
But we've got Indonesia, South Korea, Italy, the United States now.
Japan.
Well, how many of us at this point, outside of the big two, how many of us have actually had fatalities? I know we had our first today.
The Philippines and a bunch of others. There actually was a chart I was going to put there in lieu of the one here, but unfortunately, so many numbers have added to it that it's ruined the scale, and the auto generation of the chart broke. So I didn't have time to put something else together in this time. But yes, there have been deaths in a lot of different places. Iran is going to be by far the worst because not only are they using the wrong treatment because they're suppressing the immune response of the people that they're treating with the steroids, but they haven't taken certain actions in terms of stopping religious ceremonies in that QOM place. I can't pronounce the name of that. It's such a small thing. Quam. Okay. That they're still letting people gather in large numbers in close proximity, and that's not going to go well for them.
That is interesting because there was a rumor that they did shut down Friday prayer.
Well, if there's new information, I would love to hear it. Last I heard, they were still doing it.
Did you know that there are like 60 countries with COVID-19 cases?
I knew it was over 40, but I've got a lot
China,
of stuff
Hong
going on
Kong,
here.
Macau,
So.
Taiwan, Afghanistan, Algeria, Australia, Austria, Azerbaijan, Bahrain, Belarus, Belgium, Brazil, Cambodia, Canada, Croatia, Denmark, Estonia, Egypt, Finland, France, Georgia, Germany, Greece, Iceland, India, Iran, Iraq, Israel, Italy, Japan, Kuwait, Lebanon, Lithuania, Malaysia, Mexico, Monaco, Nepal, Netherlands, New Zealand, Nigeria, North Macedonia, Norway, Oman, Pakistan, Philippines, Romania, Russia, San Marino, Singapore, San Marino, really?
Mhm.
Singapore, Spain, Sri Lanka, Sweden, Switzerland, Thailand, the Republic of Korea, UAE, United Kingdom, United States, and Vietnam.
And
you know,
all,
if you're going to do that many, you have to set it to music. But no, we're being serious tonight.
That's
We're
off the
not
top of
doing
my
that.
head. That's just the ones I remember.
I know I'm waiting for
Yeah.
the Animaniac song on the coronavirus.
Yeah.
Yes.
Do
Do
you,
it to the
are
elements
those
by my lair.
are those confirmed by WHO or
This
those?
is CDC. This is CDC.
Okay, so they've accepted the reportage of those nations.
Yes.
So yeah, so it may as well be considered legit. Yes.
Yeah, I'm on the CDC site right now.
Okay,
Yeah.
And,
because I figured they'd be checking the protocol for testing, because there will be some people who are like, oh my God, we've had this many, and they'll all be either regular influenza or pneumonia. You know, there'll
Yeah.
be some of those places that they'll be misdiagnosed.
Yeah.
And there are going to be a fair number of misdiagnosed people, even in the United States. Because if you're in Hee Haw, Wyoming, and somebody comes in with flu-like symptoms, they're going to be like, God, shut down the universe. And they may immediately report it, and it'll take a while for the stats to shake out. I'm not doubting. I'm just saying, I think the numbers are probably better a week later.
Yeah, it looks like we have a death from COVID-19 in the United States. Just got
Yep.
reported.
That was in Seattle.
A
Yep.
second one.
It's a presumptive positive, just one. It's presumptive positive, which means that a laboratory that CDC recognizes as accredited has tested it, and it's positive, and it is pending confirmation testing by CDC. So
Yes.
it's presumptive positive right now.
The New
And
York,
the CDC has dispatched a full team to go. It was a nursing home in Kirkland, Washington, which
Yes.
is basically the
that
extended
was-
Seattle metro.
That was
Yeah,
the
it's
first.
way north. Yeah.
That was the first death the New York Times is reporting too.
Yeah, it's still not. Like I said, CDC response team is on it. Well, they'll be there by now, but they were on the way there because they have to confirm it
Total
in
cases,
person.
Yeah, total cases in the U.S. is 22 cases, of which
Mhm.
15 are CDC confirmed, 7 are confirmed by labs CDC recognizes and are pending confirmation. So a total of 22
Mm.
out of and travel related out of the those 22 are 13, and person-to-person spread is 9. So almost as many people person-to-person spread as it coming in, which would give you an R0 value of whatever 9/13 is. So it would be what, 0.7, 0.8, basically, roughly 0.8125, I think. And so that's a bad thing. That means that everybody who is coming into the United States is going to infect one other person.
Okay, just one moment for me to be the skeptic here. The hysteria that I'm seeing out of this blue check mark in this Twitter post. I can't read the New York Times article because it's behind a paywall. And I'm not paying those bastards, but this is a correspondent.
That's fair.
2 deaths. Some doctors wanted to test patients for coronavirus, but couldn't. 1/4 firefighters in Kirkland, now quarantined nursing home with 6 cases, had past troubles with infection precautions, patient in isolation. It's been a nightmare. There is a very, very compelling reason for certain squawkers in the United States media in particular, because of how we've seen this case framed politically already to attempt hysteria terrorism.
I'm not Prospero. I'm not doubting that. I mean, they're politicizing the hell out of it, obviously. But the fact of the matter is, the CDC has already given it a preliminary positive based on the lab that did the out testing on it.
Right. What I'm saying is the CDC is saying we have a preliminary positive, and we're going to give you more information. The New York
Yes.
Times is going with patient in isolation. It's been a nightmare. Those are the
They are in
story.
the business of selling newspapers.
Yeah.
If it bleeds, it leads.
Well-
I mean, that's, don't get me wrong. Don't get me wrong. The political angle makes them all the more willing to go there. But that is standard. If it bleeds, it leads.
Yeah, that hasn't been in the past for the New York Times.
No,
That's
you're
been in the past for the New York Post. What I'm saying is you now have large, what were formerly respected news organizations.
Okay, well,
where it's going.
I'm not seeing. I'm not seeing. I looked through some of the Seattle media because okay, you two don't know this, but I left Seattle earlier this year.
Mm-hmm.
So I looked through some of the Seattle media. They aren't as alarming as you're describing this. Keep in mind, I'm on the phone. I can't look.
No. All I'm saying,
but-
they're going to be, the local media is probably going to be the place to look.
Yeah, they do describe it as basically the nursing homes under quarantine. A section of firefighters is under voluntary quarantine. CDC is dispatched. The last I saw was CDC is dispatched a response team because they're going to physically confirm it by on site, sort of thing. Pretty much they're much more fact stuff. They're not trying to drive hype, but the facts themselves are pretty concerning.
Well, they are. Did the cruise ship people come through Seattle?
I don't know, and I'm not in a place to look it up.
Harry, do you know offhand?
Which cruise ship? There were several. They were repatriated by plane, a number of them.
Yeah.
And I think some of them flew into Travis, with the one that's in Central California, that's close to the Solano County outbreak. They think there's a connection there. And I know that some others came into different locations.
I was just curious because I know a fair number of flights out of Japan go into Seattle.
So they didn't wait. So you're telling me they didn't bring them in a quarantined plane?
No, they did not.
Jesus!
What they did is they put plastic sheeting apparently in the plane between the people that were considered exposed and under watch and the rest of the passengers that were not.
Which does you no good because you're in a sealed friggin' ventilation system.
What they did is they were supposedly running two separate ventilation systems. They had reworked it. The CDC said, do not do this. The State Department overruled.
Okay, I have information that I think is relevant here. This is Seattle local media. It's Seattle Pie. It's where I go for Seattle news, and they're running a story. There has been a second death in, I guess, Renton, and less than a day after public health officials on Sunday confirmed two more cases of COVID-19. Both in men in their 60s in Seattle and Renton. They confirmed a second death due to the virus. A man in his 70s with underlying health conditions died from the novel coronavirus when he was hospitalized. The announcement of two women in their 90s and 80s in critical condition at Evergreen Health and a man in his 70s in critical condition at the same time in the hospital brought the total cases in King County up to 10. All of the new cases announced Sunday were for residents of Kirkland's Life Care, a nursing and rehabilitation facility, bringing a total of 6 cases linked to the facility, including one death there.
Yeah.
Yeah. What it's going to come down to, though, I don't think this is going to come from the cruise ship people. They've been home too. That's too soon. What this is going to come down to, though, is Port of Seattle.
It
came in through Port of Seattle.
It easily could have. If
Oh, it has to have the incubation period's too
Yeah,
long.
and
Yeah, could
and
be.
because we were unaware of it, thanks China, for the length of time we were, and the ability for the virus to exist on neutral surface.
Surface.
Yeah. Our ports are going to be the chief ports and airports because of packages coming in on FedEx planes and UPS and that kind of thing.
Yeah, and not just bodies. In other words.
Yeah,
Yes.
oddly enough, package delivery is going to be responsible for a lot of those. But I never came in contact with anyone. I'm a hermit cases. Because they will have gotten a package that was in a warehouse, butted up against a package that had come in from China or Indonesia or Japan, where it had already had point of contact. What is the practical solution to that? It's hard to autoclave cardboard.
Yeah. Does UV kill it? Does anybody? No, UV doesn't kill it fast enough, does it?
But autoclaving would.
Well, sure.
UV's not going to get to the inside of the package. That's the thing.
You're going to have to open packages.
Gamma rays.
That's true.
You're going to have.
A neutron source sounds good to me. A cobalt bomb, that'd be great.
Yeah.
Yeah, but
neutrons are nice and slippery. They go through everything. That's a good thought. Yeah.
Now it's not an impossibility to suspend delivery of non-essentials. I mean,
I was going to say this sounds like a low-key slap at Amazon.
Well, no, but it's yeah, a little bit. For goods that come from China, and that's
meaning all of them.
Yeah, well, not hashtag not all, but there was, instead of suspending air traffic, packages should have been thought of if we had any idea of surface virus.
Yeah.
Stop package transmission. How do you do that?
Let's hold on. We're getting way ahead of ourselves.
Yeah,
again.
we are.
I want to finish a couple points just to make sure that we've got some things established, and then we'll resume this in just a very short amount of time.
Okay.
We talked about people being asymptomatic and being carriers. The average is 14 days. There's cases as few as 3 and as much as 28. So somebody can literally be exposed to it 28 days of giving it to other people before they show any symptoms. It's going to be very hard to screen people at ports of entry. That's why I mentioned this point.
Mm-hmm.
The next part of it is the transmission. We already know about surface contamination. We've been talking about it. Droplets, meaning people sneezing on you. The worrisome part is aerosols, because not only can it come from your respiratory system, but from your GI system. It's in feces. So the aerosolization of the viral load from feces is really tricky, and we'll get to that later when we talk about workplaces.
Goodbye,
so
San Francisco.
I just want everybody to keep that in mind before we move on to the other stuff. So let me just scroll down a little bit here, and we can go back to what you were talking about.
Can I just add one thing to that? I think there's one other thing you need to worry about.
Please.
And that is the typhoid Mary syndrome, where you have someone who remains asymptomatic forever, never develops the disease, and is a walking contagion dispenser.
Mm-hmm.
We had one. There was a super carrier that they documented, and I think that person spread it to 60 people that they've estimated.
We hadn't talked about it on the stream yet. I just wanted to bring that up.
Well, we're talking about policy at high level and not individual cases quite so much. That's why I'm trying to deal in the averages, because the the big question is, what do we do at these high level sorts of things? And I didn't even mention the what do you do individually within your family part of it, because I don't want this to turn into a prepper stream. And the circumstances for individuals are so varied that you really can't give advice for that, in addition to all the other stuff we're going to talk about. So that can be another stream for a later time. But we were talking about travel and trade restrictions. Go on.
Here's where it gets tricky, because as much as I made the slap about packages coming from China, therefore all of them, there's more truth to that than we'd really like to think about. And I mean, are you literally? This is where you get into the do you destroy society in order to save it thing.
Oh,
Are you literally going to shut down all commerce?
well, no, there's some common sense things you can do right offhand. If I were in charge of FedEx or UPS, gloves all the time. Now, most of them wear gloves now anyway because
True.
of the whole somebody sent, ricin through the mail. At least the postal service does. But that they're not changing those gloves after every package delivery.
Well, no, they're not.
And all you have to do is rub your eye wearing the gloves, and boom.
Can I present the counter argument for something? Just the argument for not restricting, just to throw it out there.
Mm-hmm.
As an example, there are 35 manufacturers of veterinary medicines in the United States. This is according to the CDC.
Mm-hmm.
Of them, 6 have already reported supply chain problems because they're not getting what they need from China. This is just one example. It could be human medications, just about anything else.
Yep.
When people lose work, domestic violence increases, suicide increases, crime increases, all kinds of societal rot steps in. So when we talk about things that we do because human life is sacrosanct and it's the most important thing, well, it is, but also the life and the well-being and quality of life of all the other people after the crisis passes are also important. So that's the balance that I'm trying to think about, is how do you decide between the short-term saving of life and the long-term quality of life that happens later on.
Which is why you need the hard data for mortality.
Yes, which is why we're in so much trouble right now, because we can't trust any data we have so far.
I mean,
and the places that are being honest don't have large enough sample sizes yet to really know.
In another couple of weeks, I think we are going to have that data.
This is true.
And if the mortality rate stays within reasonable shouting distance of any other influenza, probably the best thing is to not interrupt most behavior. Follow the common sense edicts. If you are ill, do not come to work. And make it clear to employees. Seriously, we're not kidding.
So what do you think of the cancel large public gatherings? Is this a thing the government should do? How do you guys feel about this?
I think assumption of risk is an individual's choice.
What is the relative mortality rate of influenza?
0.1%.
0.1%. And what I mean by shouting distance is there have been more virulent strains of flu.
Yeah,
that's what I was getting ready to ask. What were the numbers on swine flu? Does anybody know?
Well, we vaccinated for swine flu.
Yeah,
that's the thing. So you can't use that as a comparison. We have no vaccine for this. The 1919 Spanish is the one you want to look at.
Well, that was yes and no.
Well, unless you were 500 years old, you had no immunity to that one.
But what I'm saying yes and no about is medical care is 100 years on from the 1919.
No, she's right.
No, swine flu had a mortality rate of 0.02%, so it's very, very low mortality.
Yeah,
rate.
the avian had a higher one, I think.
Yeah.
But she's right when she talks about not trying to compare it too much to Spanish flu. She's very much right when it comes to the Western world. I think you can possibly use the Spanish flu numbers in the
2.5%
developing world.
mortality rate for Spanish flu, by the way.
2.5?
That
2.5% for Spanish flu
Yeah.
of 1918. Influenza pandemic was 2.5%.
In the United
and
States?
I wouldn't be surprised if that does hold pretty true in the developing world. You catch where I'm going with this?
Yeah, I need to ask one question, Skep. Was that in the U.S.?
No, that was worldwide.
Really?
An estimated 1/3 of the world's population were infected and had clinically apparently illnesses during the 1918-1919 influenza pandemic. The disease was exceptionally severe. Case fatality rates were right at 2.5%, compared for 0.1% in other influenza pandemics. And
Okay,
I've got case citations for all that.
Oh, okay. I thought it was higher. I thought it was a 10.
No, it was just
closer to
2.5%.
10%.
Unfortunately, my uncle was one.
As nauseating as it is to say, that's within shouting distance of 0.1, because it's not clearing 5%. I think if you were looking at mortality rates of 5% or above, God, I hate talking about things like this in numbers, because we were talking about human beings. You'd be seriously concerned.
Now, that's different from a case fatality ratio, which I think is actually what you think mortality rate is. Case fatality was like 10 to 20%. So an estimated 10 to 20% of those who were infected died
of the Spanish flu.
Spanish flu. And that's a case fatality ratio. That's different than mortality.
I think that's what
mortality
we're
rate
thinking of,
is
is the
different.
case mortality.
Yeah. The case fatality ratio is what that's called in the public health business. I'm teaching myself. I'm autodidacting public health in real time right here, guys.
Okay, then you do need to tell us all what the difference is.
All right. Let me wait for the article.
Is one a mortality rate against the entire population?
Yes, exactly.
Okay. That's
exactly what it is.
Okay.
That's what I was thinking, yeah.
Yeah, case mortality rate is something.
Case fatality ratio is what it's called.
Case fatality ratio is probably the thing.
CFR, we call it in the public health business, now that I'm in that.
We probably.
But I think in the developing world, we'll see one rate, and in the Western world, we'll see another, and they will be drastically different. And that's the data we're going to have to wait on.
They actually were as far as I'm aware, they actually were in the Spanish flu, because, people with access to healthcare, in the cities, and also based on wealth, had a better shot at it.
Here's an interesting thing, because we've seen some censorship by China on this, and they did this with the Spanish flu. In fact, that's how it got its name. To maintain morale, wartime censors minimized the early reports of the illness mortality in Germany, the United Kingdom, France, and the United States. Papers were free to report the epidemic's effects in neutral Spain. Okay, so Spain didn't censor there, and their own king, Alfonso XIII was very, deeply sick, and these stories created the false impression of Spain as being especially hard hit, giving rise to the pandemic's nickname, Spanish flu.
Yeah, and that's not where it came from, because almost, we've kind of learned that the influenza seems to cook in the Far East, and then spread around the world. Right. And we also do know, and this is to address the rumor mill of this will resolve itself by summer.
Yeah.
Influenza spread is much greater during the fall, winter, and early spring than it is in the summer. You look at case rates.
Of course, most of the people who did not die from the Spanish flu. What happens with viral infections is they weaken the immune system. Spanish flu was a cytokine I do know this from my years at Pfizer. That was a cytokine intensive infection, which means that your immune system is shot. And what happens is you get an opportunistic bacterial infection that comes in. It's that super infection that gives you sepsis, and you die from that. That's what killed most of that's what probably killed 9/10 of the people, not Spanish flu. Spanish flu shot up their immune system, and then a bacterial super infection came in and opportunistically killed most of the people.
Well, that's what still kills a great deal of the immunocompromised and elderly with regular influenza.
Of course, absolutely
is a secondary bacterial infection that'll present as pneumonia, rapid onset pneumonia, sepsis, death.
Yeah.
Well, I mean, when you get down to it, I know it's unrelated, but that's the same thing that happens with AIDS. AIDS isn't what kills you; it's the fact that you no longer have the ability to fight so much as a sniffle.
Exactly.
Yeah,
exactly right.
Those kinds of cytokine reactions are common in viruses, and it's just the nature of viral infections versus bacterial. It's why we cooked up the pneumonia vaccine to some extent to try to counter caseload on pneumonia. We are more
on bacterial pneumonia.
On bacterial pneumonia,
right?
Which at least if you've had the pneumonia vaccine within the last 5 years, gives you a leg up on maybe not developing a secondary bacterial pneumonia when you have the influenza.
Provided you get hit by the right strain. That's another problem.
Yeah, but the
strains change every year.
We still have remarkable interdiction against sepsis now. I mean, it's not great. It never is, because when the body goes into cascade, it's hard to stop it. But we have better survival of opportunistic secondaries than we used to.
Okay, we're getting down in the weeds here.
No, but that's why I'm saying in the West, in the first world, we have better interdiction for cytokine.
Yeah. Which was my point. There's going to be two different mortality rates, and for us anyway, as we're all American centric right now anyway. Until we actually know the Western world, the first world mortality rates, we really don't know anything.
Yes, because I mean, for purposes of our decision making in the United States, Canada, absolutely.
And it's worth noting that both of our first two fatalities, assuming the second one does get confirmed, up there in Seattle, are both elderly people.
Right. I've got 3 pieces of information that I've been saving. First of all, there is a community transfer infected person in Mountain View, California, which is the home city of Google, for just fun fact there. And it's a 65-year-old woman with other health problems who
exactly.
She came in on a Wednesday. Her doctor said, this does not look good. She was tested on a Thursday. They had the results in 2 days because it turns out there are labs in California that can actually do the test, which we're coming up on as the next question. The projections
I would like to know where
she
is. I would like to know if she is.
Would you like the room number? She's in El Camino Hospital.
Yeah, I would like to know if she's in the hospital or not.
She is. She's in El Camino Medical Center in Mountain View, California.
Wow.
Which is so close to my office that I don't even like to think about it. And close to one of the places I like to play pool. So 30% is the number that a lot of people are talking about in terms of, because it could be as much as 60%, but a lot of the experts are thinking that the expected outcome is that 30% of the world is going to contract this year. I hope that number's wrong. I hope it's wrong. Gosh, what was the other thing? There's another study that came out recently which shows that the coronavirus, this particular coronavirus, seems to be not prone to mutation it's a fairly stable virus as they go.
Hmm.
I guess SARS and MERS supposedly are similar in that respect. The main difference is with SARS, you were not sloughing off viruses so much when you were asymptomatic as this. This one's just much more insidious from a spread perspective, even though it doesn't seem to have the same lethality as SARS did. But that does mean that the likelihood that we can come up with a vaccine that will work for some period of time is a lot higher.
Mm-hmm. Yeah, it is. If it doesn't show mutation, prone to mutation,
This brings me back to Israel for a second, because I believe you guys brought up that the Israelis said, "Hey, we have something that shows some promise on this."
Mm-hmm.
Yeah, one company is.
Well, they weren't. They obviously weren't working on this. They didn't know to be working on it. So, what were they working on that's related enough to it?
There has been a variation on. This is a zoonotic, in all likelihood, or a result of lab work on forcing zoonotism. Would that be the way to say it? Because so many influences, like we say, the bird flu or the swine flu, or these terms mean
it's just that it mutated in a particular animal.
It made the transfer from the animal to the human. AIDS is a zoonotic.
So effectively, you're saying that this is basically bat flu.
Or snake flu or whatever.
There was an interstitial species. The bat coronavirus studies are a little too far away. They think there's another hop in there, but they haven't identified what it is yet.
But the minute you have, sorry, Scott.
I just wanted to you were talking about the Israel thing. Israel is only weeks away from developing a vaccine against the novel coronavirus, according to its science and technology minister. The Jerusalem Post reported Thursday that Minister, unpronounceable name, said in a press release that the vaccine would be available to patients within 90 days. And he credited the Galilee Research Institute for the breakthrough. And they said, "I'm confident there will be further rapid progress enabling us to provide a needed response to the grave global COVID-19 threat," he said. Israel got a jump on the coronavirus crisis because researchers had already created a vaccine against avian coronavirus infectious bronchitis virus, IBV, which affects poultry, according to the Jewish press. The IBV vaccine has already passed clinical trials at Israel's Veterinary Institute. So they basically adapted an existing vaccine.
Mm-hmm.
Okay, so they were working on a relative.
And the guy from Miguel said, by pure luck, quote unquote, by pure luck, the Miguel team selected a poultry coronavirus to test their new vaccine technology, which doesn't target any specific virus, according to unpronounceable name biotechnology group leader at Miguel. Unpronounceable name told the press and the Post that after the current COVID-19 broke out in China, the researchers studied the new virus and realized it was genetically similar to IBV and that the infection mechanism was the same. They're now confident they can adjust the system to combat COVID-19.
That is
wow.
Yeah, that's a. I mean, here's the thing.
Sometimes you catch a break.
Yeah, you do, and that is dumb luck. What goes on all the time in labs when there are infectious diseases among animals with whom humans come in regular contact.
Yeah.
There will be little epidemiology labs all over the place, poking and prodding and taking a look at those viruses because of high degree of transference historically of viruses from animals to humans. And what's peculiar is because the Australians had been doing some work on, I think, the bat COVID coronavirus, whatever it was. People are like, hey, this is proof it's a bioweapon. Let me tell you something. It's a shit bioweapon. So if you're going to design a bioweapon, it needs to have the lethality of Ebola. 90% of the people, 2 days, boom, dead, boom, dead, boom, dead. This isn't a bioweapon. This may have been lab work that was being done similar to what the Israelis were doing, where somebody didn't follow proper protocol
Yeah.
and it got free of the lab. But
We can speculate till eternity.
yeah, we'll never know the
Oh,
provenance. This is, you can't trace
Right.
the provenance. Except
Well,
a bioweapon is designed to disrupt far more than this has.
well, let me make a counter argument. Yeah, when you're talking about bioweapon, you're thinking militarily. This thing may turn out to be economically an incredible bioweapon.
Well, so was the Black Plague.
I understand that, but
Yeah, I don't.
point being, this it doesn't necessarily. You don't necessarily have to make a bioweapon that kills everybody. If you make a bioweapon that is scary enough to shut down an entire society, you've done just as much damage, just in a different arena.
Yeah.
Now, I'm not saying I think it's actually a bioweapon. I'm saying there's an argument to be made for an economic bioweapon.
Yeah, there is an argument to be made. Cynical Lindsay makes a good point in the chat that they were talking about the bioweapons. She was talking about the bioweapon speculation with her husband, and that China wouldn't do that because it was far too risky. They could wipe out their entire population.
Right.
With a high enough
also, I think
morbidity rate, and and
even if it was a bioweapon, it's not an intentional release.
No. I think you're dealing, if it is not, if
screw up written all over it.
It's got it has bad lab protocol written all over it, because of their, if China is reporting this accurately, ground zero for it. It's in all,
it is actually about the worst place it could have got loose in China too.
Yeah, but it's also just somebody, I mean, hell, this is just a large scale version of somebody not washing their hands after they wipe their ass and going out and picking spinach.
True enough.
It is one of those.
There's the two known facilities. This is definitely accidental. There's the two known facilities, the one that's a biological one and the other one that's apparently veterinary research.
Could come from either one of them.
It could have come from either one of them, right? That's why you can't really rule out bioweapon and not fully anyway. This is not intentional. This is a screw up. And the reason it's a screw up is, or the absolute best way to know it's a screw up is because even if the Chinese wanted to unleash it upon some part of their population, that's the worst area for them to have released it in.
Yeah, no, they would have.
That was the easiest area for it to get out of control.
They would have used it on the Uyghurs before they would have done that.
Exactly.
Yeah.
Let me interject.
Too bad
something,
about
if
all
I
those
may.
Muslims dying.
Yeah, I'd
So
like to
on a
interject
related
something and then
topic,
move on to the testing thing if we can, because we're getting deep into speculation and we've got a lot to talk about still.
yes.
So there was part of what fueled the speculation of it being a bioweapon was a pre-released, not peer-reviewed study from a group in India, which found they did a blast search, which is basically like Google for genomes. And they took some of the information that had been from the sequenced genome of this coronavirus, the novel coronavirus, and they were looking for things that had commonality with those sequences. And they found similarities in some very short sequences with some HIV sequences. But those same sequences occur in lots of other completely unrelated viruses as well. And they have this was brought to their attention, and they have subsequently retracted that article. And a lot of people have looked at it and don't really think there's any credence to it based on that. But that's sort of what started the speculation.
It's the 4 proteins in common thing. It's that,
Yeah.
and it didn't take very long for a number of people to go, do you know how many common proteins?
Well, they gave them a list.
Yeah.
I think there was at least 20 something
Yeah,
things
it's
that
like
the same patterns.
HIV has in common with a large number of viruses. It's like the coronavirus that mimics the rhinovirus. People are like, well, rhinovirus is a coronavirus. No, it's similar to what we call the common cold.
Right. And not a zoological, by the way. So, even though it sounds like it is.
Yeah.
But anyway, can we move on to
it's when we bake up ourselves.
So what do we want to do about
before we
testing at the
wander before we wander too much, he made the point about the Uyghur Muslims, and it just strikes me that 1979, 2019, 40 years.
Mm-hmm.
Okay, so 40 years of embargo against the Islamic Revolution has not done anything about it, and this might wipe them out.
Let's hope not. I don't want all the Persians to die.
No, I'm talking about the government, because it seems to be running rampant in their government.
I'm supposed to be a decent human being, and say, if it takes out the mullahs, I'm gonna think, karma. But
mullah-specific viruses.
Yeah, well,
there's also the Pope has some illness too, and they're not talking a whole lot about what it is.
Yeah, it's
a moral weakness, actually.
Yeah, it's they're giant moral holes in that man.
Well, they've got a spare, so
many opportunistics could come in.
Yeah. I understand that people have moral quandaries about it. I'm just so cynical that I would see the irony in that. And if the Islamic Revolution finally falls because of this, after all of the efforts that have been taken, that would be kind of amazing.
Loving and merciful God.
The greatest irony of all would be if the vaccine comes out of Israel.
Oh yeah,
it would. What would be even better is if the Iranians refused to take it because of that.
Yeah, or the BDSers also.
Yeah, that's fine with me. That is
Mazel tov.
Being a small L, being a small L libertarian, people are allowed choice, and if you don't want to take the Jew juice, just don't.
Well, there's an item about that later. So, but let's move on.
In other words, you're allowed to pay your dollar and take your chance.
Oh, I mean, if they get that vaccine out, I don't care if it's labeled Jew juice. I'm going to be first in line. I'm
going to fly there and get my dose early.
Yeah, I mean, it's just
like, I've never been to Tel Aviv. It looks lovely.
I know. It's like I've always wanted to
it's a very lovely place.
Visit the promised land, and I'll more than happily roll up my sleeve when I get there.
I'm going to go there. I'm going to partner with somebody, and we're going to open a clinic in the airport for people who just want to fly and get the jab and get back out.
South Korea, though, you're talking about innovation and testing.
I know. Well, let's move on to that.
There we go. Because welcome to Wendy's. Here's your test kit.
Apparently, don't they actually have welcome to Wendy's testing in South Korea right now?
Yeah. Yeah. You drive up in your car and they test you. You don't even get out of the car, and they take your details down, and then the next car comes in. Nobody has to go into the hospital. You don't have waiting rooms full of people that are sick, exposing each other. It's safer for everybody.
I gotta say, that's kind of genius.
It is. It's innovative.
It's kind of amazing. Yes,
it's innovative as hell. I mean, if you can do it with banks, why not do it with this?
So, should the government pay for this testing? Is that a public good that small?
You can make a national security argument for it. Yes.
Wait. Can I amend your proposition? Should the taxpayer pay for this?
Mm-hmm.
Still, Skep, still, you can make a national security argument for yes.
I'm not saying you can't. I'm just saying, should the taxpayer get stuck with the bill?
His point is, should the government being the people who fund the government.
I believe me.
I'm libertarian. I am on board with him. I get where he's coming from on that. But like I said,
he understands what I'm saying.
Yeah, it's a semantics matter.
It's a word. There's a wording difference there.
Yeah,
that's no big thing.
Actually, it's a banking matter.
Well, in these days, that's become a national. Should it be? No, but and these days, it's become a national security argument.
The sad thing is that it actually will cost so little that, in comparison to other budget items on the POM,
why not
program objective memorandum, which is the budgeting device of the government, it's not even a rounding error.
Yeah,
I have an idea.
Not?
Yeah,
I have an idea. How about we go down the list and everybody says whether they think the government should pay for it or not? Basically, yes or no.
Go ahead.
So who thinks?
No.
Okay, you say no, Sniper.
I'm okay with you doing this.
Okay,
let's run the thought experiment.
You're
Why
a
not?
yes. Well, so Prospero.
Oh God, horns of a dilemma.
Oh, you're talking about the actual Skip. You're talking about should they pay for the test? You're answering that question.
Yes, that's what I thought the question was.
That's the question.
Okay.
I think it should be like the flu.
Yeah,
like the flu shot. So if you're on Medicare, it's part of that. If you're on insurance, it's probably covered by that. But
well, let's be honest, the flu shot is somewhat subsidized.
Well, the CDC is subsidized.
Yeah, I mean, you can say almost everything.
So it's a yes in that these things are subsidized, but it's a no if you have insurance. Yes, if you don't have insurance.
So we should give it to people
because it is I would say yes, just because, as he points out, it is literally a rounding error in the math, and there's just too large of a.
I don't want to.
Government exists fundamentally from a libertarian point of view to protect life, liberty, property. Okay, of its citizens. Right. Well, this is attempting to protect the life of the citizens.
Yeah, and
there's a legitimate argument there.
That's a legitimate argument. I tend to just, I arch my back up against any of this stuff, and
I will accept. I will accept that we pay for it, that the government pay for it. That's not the hill I'm going to choose to die on.
Hill I'm going to die on either. Don't get me wrong. I'm not a fanatic about.
I don't want to establish.
I would like to try and find a different way.
I don't want to establish precedent. Of we have X crisis. I mean, it's a little bit like public schools insisting your child have a shot against
Don't worry about it. That income tax is just temporary.
Well,
it's going away.
Well, no, actually, I have a point to make about medical, because it's like insisting that all children get the vaccine for sexually transmitted disease coming from the government. That writ of mandatus, you will have the shot again. Now, human papillomavirus, I would, like to protect my child from that. But to force the matter,
where it becomes weird,
because this is an transmitted disease, not a goddamn thing like the measles.
By the way, I'll be right back, guys. Hang on. I'll be right back. You guys talk amongst yourselves.
Where it becomes weird, and this is an anti-libertarian argument for a moment, is this is one of the reasons, like I said, the flu shot is partially subsidized. You can actually go and get a free flu shot.
Oh yeah. Yeah.
So letting people get it and transmit it who would get tested but ain't got the money to pay to get tested.
I'd rather.
That's just. I would rather them be able to get the test for free to know that they need to lock themselves in the house for a couple weeks.
Ideally, what I'd like,
so that I don't have to deal with them at work.
Ideally, what I'd like is for people who are able to toss in the $5 to get the test to actually pay $6 for the test. So they're tossing into the community chest for the people who don't have the money.
In theory, that's no longer the way anything's run.
No,
but
I know.
In theory, if they didn't have an administrative state, I'd be with you on that.
Yeah, in theory.
I look at it and I see the national security argument, and the protect the life of your citizens argument. I go, okay, I can make a libertarian argument for it. It is a rounding error in the math. Screw it, just do it.
Yeah, because these kinds of things don't come around every day anyway.
No, they don't.
Yeah, I'll take this bitter pill.
Yeah, and I understand. Trust me, I understand
for the better good, and it's not. I don't think it's that big of a debate. I don't want legislation to be written that codifies and heretofore all things be like this. I want this to be an emergency declaration. Kits will be provided by the government, yada yada, which comes off at least as a one-time deal. Instead of, and the thing is that those who refuse to be tested, and Harry, this gets around to some of what you were talking about. Mm-hmm. You're going to run into Jehovah's Witnesses. And look, I don't mean to malign Jehovah's Witnesses, but we all know the court battles that have gone on and on about blood transfusions and this, that, and the other. How much of the force of the state is going to be used to compel people to get tested?
Well, the test isn't a blood test. It's a swab.
It doesn't matter. Some people.
It doesn't matter to them.
It's still a principle. She's not wrong.
So what about the Korean death cult? I don't know a whole lot about them except that they are numerous and worldwide.
Elevator button lickers. Those assholes.
That's a catchy name that they came up with.
Well,
I wish that was actually their name.
It ought to be. Yeah. Well, fuckwit's been taken, I think. Yeah. They're like the Comet cult. I do really wish these people would just simply go Jonestown themselves. I'm sorry.
Well, in California, they recently changed the law so that transmitting HIV intentionally to somebody I think it's a parking ticket, essentially. It's an infraction.
That's only in California.
It's a misdemeanor. It's
being set in law.
It's a misdemeanor.
I don't see how somebody who would intentionally spread a potentially lethal disease is not at least some kind of assault. And we could go after them based on that, if that's something they were actually doing.
Oh, absolutely.
It actually would be a battery.
But that's because you have free brain cells in your head that work.
Yeah, it's not assault. It's
it would be a battery. It would be.
It's battery.
Also, it would be an offense to the person. Would be something physical you did to somebody. It's not saying I'm going to hurt you. That's assault. It's hurting them. Mm-hmm. It's battery.
Well, and it's battery. And it's public endangerment. And
public endangerment.
It's
how about attempted murder while we're at it?
No.
Well, what if somebody has comorbidity?
No, you can't. But you cannot reasonably expect that the individual committing the act knew of the comorbidity.
Well, what if they did it in a nursing home? We can do hypotheticals all day, and I'm going to stop.
No. If they did it in if they did it in a nursing home, I wouldn't even try them. I'd put a bullet in them and roll them out.
No,
I wouldn't. Of course I wouldn't. I would charge them in that case with aggravated battery.
Oh, I thought you were going to say with a bayonet, but okay, that's good.
that would be me.
When you said
Tempting.
charge,
No, Harry, you don't understand. I use trains now, so it's choo-choo, motherfucker. I just strap them to the tracks and go all Dudley do bad on them.
We're going to have a trolley debate.
We can get trial by trolley sponsorship from the Cyanide and Happiness. Anyway.
Yeah, but the death cult people do need to be arrested if they are CCTV'd in public buildings doing that kind of thing. It's I don't want to turn into the anti-hygienic squad, okay? This is the whole thing. I am caught between the wait, no, don't crisis this thing down to the last jot and tittle yet. But keep in mind in future, these things might come up. Because anybody who knows that they're infected, who is willingly like licking elevator buttons, despite having eaten all the paint chips in the world, is a danger to society.
Prospero, I love you right now.
Thank you, Sniper.
She wins everybody over.
That's amazing. Sorry, continue.
All right, so we're solving the world's problems one at a time. So how do we feel about quarantines? Voluntary or worse, mandatory?
If you have been exposed and you are the R naught is going to matter. Our numbers on the R naught are going to matter. If the R naught goes from 3 to 30,
well, yeah,
you've
that's a huge difference.
Yeah, I don't know what number do you pick? What number do you pick where you make it mandatory? We did with tuberculosis for people who tested positive, move them to sanatoriums. My grandfather, who I don't think really had tuberculosis, but I think he may have been a carrier, but he didn't have the kind of lung scarring or any of that kind of damage. He lived too comfortably for the rest of his life, was sent to a facility in the Blue Ridge Mountains. And it was not willful. He was removed from employment and sent there. Lepers were removed to leper colonies. Reagan shut down the bathhouses.
Well, I have a scenario for you, which I think is close enough to being near term that I'm not even going to call it a hypothetical. We've established that the virus can be spread through feces. We've talked about San Francisco.
Yeah.
We know that San Francisco is smeared with poop from homeless people, many of which have mental health problems that are really extreme. I don't need to be a doctor to realize this. I can just go there and see people screaming at the sky and shaking their fists at people and having spasms and things. It's absolutely horrible.
Pelosi.
Yeah.
Well, it's part of our turfing out the incredibly mentally ill.
Yeah, this is actually this subject is actually one of the areas where I struggle in my libertarianism, because they shut down all the mental hospitals
On First
and
Amendment.
now you have all these homeless, because that is the reality. Is homelessness never really got talked about in this country when there were the state mental hospitals.
Yeah.
Because most of your homeless, not all, but the vast majority of them are people who are, for one reason or another, sometimes no fault of their own, just not able to function.
Yeah, they're misfits. quite literally misfits.
And
It-
so
you know,
that goes against libertarianism to lock these people up just because of that. But at the same time, well, look at what they're doing in San Francisco.
there's been, I mean, I had this discussion in the 1990s with somebody about the turfing of the mentally ill on First Amendment grounds, if I recall, was how the ACLU took it. They and Eighth Amendment, they did a service and a disservice at the same time, because it's kind of interesting, but most paranoid schizophrenics aren't dangerous. A lot of psychotics aren't dangerous.
Not to you. They can be dangerous to themselves, but not to you.
Sociopaths are far more a problem than psychotics, but they're intensely vulnerable, because the sociopath will be happy to steal from the psychopath. The person walking down the street in their bedroom slippers, pushing a shopping cart full of baby dolls,
screaming at the Archangel Michael,
talking to Jesus, is likely to get rolled for their last nickel by the sociopath, or killed just for jollies, or raped, or whatever. This is what is moral and what is legal come into conflict here.
Yeah.
And what is moral is to protect these people from predators, which is to isolate them and care for them.
What is legal, comes in contact of
what is legal is to grant them full liberties, and
that's where I was going.
Allow them to gibber down the street.
Gibber.
It's
nice verb.
Thank you. What's my word score on that?
At least double word score.
Thank you. I wish we do what was moral a bit more than what was legal. And Skep can swear to this. I can be an absolute Nazi when it comes to the law.
Yeah.
But there are times that
the good kind of Nazi.
Law and morality come into conflict.
And there really is no easy answer.
No, there isn't. And one of the problems is the laws that were written regarding mental illness were being misused. And that's one of the reasons these people got turfed. Because there were a lot of people that were put in mental institutions who did not belong there. We've all seen or heard of One Flew Over the Cuckoo's Nest. That
was a case of incentives, as a certain person that Harry and I know likes to point out.
Yeah, but there were a fair number of people over the course of time who have been institutionalized because they were in the way.
Yep.
And with money and power, it's very easy to remove the person who was due to inherit daddy's money because they were eccentric. I mean,
there wasn't just that. I mean, there's that. There's the psychotic family members, but there's also once someone was in one for observation, the incentives of these institutions were to keep them at all costs.
Oh yes, but I mean,
that's where I was going.
I mean, look up the history of Bedlam in London and in Great Britain. Look up Bethlehem Hospital, and the people that got put in, some of the people that got put in Bedlam were crazy. I mean, they were like, woo, woo, woo. And then some people were consigned to institutions because they were just simply problematic. They thought the wrong things, or they were in the way of a spouse. Divorce was very difficult. It required an act of parliament. In the United States, it required far more than it used to. And the best way to get a problematic spouse out of the way was to say they're crazy. A lot of people got jammed in institutions who did not belong there. And a lot of people who belonged in institutions did not. So, yeah, between the incentive and the rest of it, this is the care we're going to have to take in looking at public health going down the road. And maybe this coronavirus is going to turn out to be an interesting...
Might have a silver lining.
Yeah, it might have a silver lining in how we view liberty and how we view responsibility to society.
Well, on that note, are you ready to go to number 5?
Yeah, I'm so sorry. I'm sorry.
You're fine. You're fine. So I had this thought because I do computer security stuff and a lot of other things.
That's dangerous.
One of the many things that I do. And it occurred to me that if I was evil and I had control of the government and I wanted to do some sort of PRISM type thing, you could just start snooping on people's electronic accounts and probably do a very good job of determining where you should focus the attention of your public health people. How serious would an illness need to be as a threat to the existence of the nation for something like that to be acceptable? Because I'm extremely uncomfortable with it. The fact that it occurred to me makes me think that I'm sure somebody else has thought of it too, because there are specific symptoms that you could look for. And then you could go back and look at the associations because they have the tracking data on everybody's cell phones. So not only could they figure out if you're sick, but they could determine who you came in contact with.
Would you like me to get real cynical for you, Harry?
I think I'm already pretty cynical. I don't want you to get.
Yeah, I was gonna say that was like, I'm not touching that.
Do you not think that the second they put that lady in the hospital in Mountain View, Google didn't start looking at that?
I don't assume anything. I don't think Google did it, but we saw what happened after 9/11.
No, in
Google's
fact,
the ones that already have the backbone to do it.
No,
I want to hear Skep's opinion on this because he's an expert in this area.
Google would never harm us. Google is our friend. Google does no evil, and I love Google.
After what I said, you get a smart-ass answer like that.
Well,
I'm not paranoid at all.
No, he's not.
Oh, for fuck's sake.
It.
I can't bring up anything that I don't find out what it was I bought 2 weeks ago from Google. I can't stand that.
That was the joke. He's
Yeah.
I know
he's
what
saying. Yes, I agree. They're already doing it.
Yeah,
Yes,
of course they are. People are. We've been the minute we had cell phones. People,
masters.
But that's actually where I was
to serve them.
Mm-hmm.
I was being talked to for a second, so I had to be muted. But when you said your thing about silver lining,
yeah,
I have a much more cynical look on this, and it's because of the fact that I guarantee you, Google is already looking at that, and it's just a matter of whether they decide to tell the government.
Yeah,
and I see that going the bad place more than I see that going the good place.
of course, because
I think they'll be responsible with it. We'll be fine. Everything will be just fine.
Yeah, this is the lifeboat exercise. Google gets thrown out first. I'm sorry.
You'll receive an SMS message that just says, report to your local testing center for evaluation.
Yeah. I mean, Google gets in the lifeboat. They're going off before the lifeboat hits water. I'm like, fuck you. We don't need your internet. For the health of human society, the moral health of human society, die. I won't be able to remember who was in what movie. That's fine.
There is that, but I would say Twitter probably first, but that's a mental health argument instead. I just the point I'm making is they're already capable. It's not a matter of can they. Google is actually already capable right at this moment.
Absolutely.
Well, Google is
just
Google,
by adding one more algorithm in the mix.
No, it's not. Well, Google could do some of it because you could look at people's search history and trace it back to them. That would be a way to do it.
Yep.
But the government has their hooks into all sorts of telecommunication stuff, the SMS messages and the phone logs.
I was just going to say, what about SMS?
Yeah, well, that's exactly what I was talking about. That's why they'll send you an SMS telling you to report for testing. Oh, you asked you told a friend that you had diarrhea. Okay, well, that's a thing that happens with the coronavirus sometimes. So they go and deal with that thing. And also, a lovely fun fact is if you get diarrhea when you have the coronavirus, the plume of aerosol can go up to 200 meters, carrying the virus to whoever might be nearby.
The plume of aerosol of diarrhea.
I'm speaking very
the
yes.
Thank you, Harry. Thank you.
You're welcome. So shall we go to number 6 since I just brought things down to a really poor level?
Let's head to a different plume.
Okay. What, if any, resources should be allocated to refugees at the border or foreign aid to address the crisis?
Oh, I have 2 different answers. Which one do you want?
Bullet in the back of the deck. That's not nice.
Well, the problem is that certain materials, like I said in the outline, like oxygen therapy, we're not going to have enough for domestic use. It's not necessarily money. We could just print money. We know how to do that. We could print money and send them a box of it, but that's not going to save anybody's life if there's not enough resources. So when you take your kid to the hospital or take your mother to the hospital and she needs oxygen therapy because her pulse ox is all messed up, and you look around and you see a lot of people there who are, in basically refugee status, is this going to change people's mind about this sort of thing? Are they going to feel the same way they do now that everything's convenient and running well, when they find that people that they love might not get the treatment they need because there just isn't enough to go around?
Like I said, I have 2 different answers. Which one do you want?
Just go with one. I don't.
The one that won't
pick one
off Google.
Okay, so from a moral point of view, there's the argument that it is not right for us to prevent resources from saving as many people as possible. But the reality is, life of the citizens, liberty of the citizens, property of the citizens, and everybody else can take a walk.
Right. The moral thing to do is to put everybody into triage and use the resources in the manner which saves as many human lives as possible. However, that would be if you go to the medical center in Topeka, Kansas. What about people trying to come into the border? What if you have 100,000 people infected with the virus trying to cross into the United States as refugees?
Yeah,
What's our legal obligation? Honestly, I know that we are obligated to help refugees based on treaties that we've signed and established. But normally, I don't know what our obligation would be under the law, let alone morally in that case.
Under the law, I don't know that we have. I don't know that there's actually any law saying we have to take medical refugees. There's political and religious refugees, but I don't know of medical refugees.
If there was an environmental catastrophe from a volcano or, just any number of different things, we would have to take refugees.
Not as far as I know.
Well, maybe Skep knows, or Prospero is on hold at the moment, because I honestly don't know the answer to this, but I'm trying to identify the difficult moral questions that this could present to us. That's sort of the whole point of the exercise.
Are you trying to do it from a legal requirement point of view or a moral requirement point of view?
Either and both.
Okay. All right. Let's see. If you listen to Democrats today, the left, they think that we should be providing sex change operations for illegal aliens, people who cross the border illegally. So that's obviously in the area of ridiculous. And, we don't have the resources to do that. Where you pare it down are to immediate life and death type of issues. If the Border Patrol finds somebody who has crossed the border illegally and they need emergency treatment, we take them to an emergency room and we get them emergency treatment. That's the way that is done. Is this the same thing as emergency treatment? I don't think it is. I honestly don't think it is. So, in terms of that, if somebody was an illegal alien who came into our country, we would probably treat them with a vaccine because we didn't want them to infect other people here. Or if we had a cure for it, we would treat them with that. But that would be just because it would be in our best interest. That's what would drive that decision, not because we had a moral issue, a moral obligation to do that, because I'm not sure that we do.
Now that's for the people that already made it in. The question is, how many
we're talking about
do you have to let any of them on the border? Legally, I do not believe that there is a such thing as medical asylum. Not in law.
So, I see what you said, because they can't get it in Mexico, so they come. Yeah, no, I agree. I think that probably falls outside our ability to provide.
I know, like I said, I know there's political asylum. I know there's religious asylum. I do not believe there's medical asylum.
Well, there is no such thing as medical asylum. I mean, it doesn't exist in law. I know.
That's what I'm saying. I don't think it does.
To know that, but whether or not you'd have a moral obligation to do that, I don't really think you do.
So we could give foreign aid to Mexico or even Canada if we needed to help them try to treat people there, but not necessarily let hundreds of thousands of people come in and overwhelm an already overwhelmed medical system because we're in the middle of an emergency.
And how about letting the UN use some of its resources, and instead of them arguing about the feminizing of trees or global warming
or hydrofeminism
or any of the other nonsensical things they waste their sizable budget on, let them prove their worthlessness.
That's what I was getting ready to say, but thank you for summing that up.
Of course, they do that every day when they get
because I think the moral obligation of a nation is to its people. If we have leftover peanut butter and jelly sandwiches, we can give them to somebody else. But
we have to have the leftover PB&J.
I think we've tenderized this horse pretty well. We could certainly go further on it, but I would like to move on to the next issue.
I actually do have one question.
Okay, just be succinct.
Let's say you've got it. Let's say we wind up with it relatively under control, as I imagine we will, and that's why everybody's coming. Do we then have an argument, or is there an actual argument to tent city and treat those people at the border just because they're going to try and sneak in anyway?
Share them with the governments in which they reside. If they're tent citied in Mexico at our border, let Mexico take care of it. We can share with them if we have leftovers.
And CNN will have cameras on them watching them starve, as Mexico does nothing.
Yeah, but my point is that's all you can do, because you cannot fill a pothole, and you'll never fill a pothole to suit potholes like Brian Stelter.
You're absolutely right, but here's what will happen. CNN will have the cameras trained on the refugees as they're slowly starving to death and dying of disease, and they'll say, we remember the Berlin airlift when there were white people who needed food, and we brought them food because they were white, but these are brown people, so we're not going to help them because Trump, the orange man.
Okay, for Christ's sake, then just trebuchet a bunch of peanut butter and jelly sandwiches across the border into the tent city.
But seriously, you see what I'm saying?
Oh no, I know what you're saying, but this is a lose-lose scenario.
Yeah, pretty much.
It is. It very much is. But
this is why the press is being hysterical about this now. They're hoping they can close this trap before November. Literally, that's what they're hoping they can do.
Ironically, I think it's going to backfire on them like everything else.
Of course, it will.
The fact of the matter is, the man has been screaming about China as a problem to anybody who will listen for years, and I think people will remember that. Hey, wait a minute. Even the ones who don't pay attention are going to go, hey, wait a minute. Hasn't Trump been saying that there's problems with China?
That's not.
Why would we blame him?
That's not actually, it's interesting. It's one of the reasons why they went full bore right out of the gate. Racism. As if Chinese is a race. But they went immediately to white nationalist isolationism, as the New Republic did, as their tack of trying to mitigate Trump saying, I told you China was a problem, didn't I?
I still think, whether he says it that way or not, I still think just the collective memory
It'll depend on how
he's been bitching about China for years, and lo and behold, look, this thing comes out of China. He was right.
It will depend on how many people are infected as to whether they try to blame it on China. It's a I would, out of intellectual honesty, have to say, China may have done an oopsie in the lab.
So sorry.
I'm not going to blame that entirely on China. What I'm going to say is that it's China's save face behavior that's always been the issue in dealing with them. And if you ever underestimate their save face behavior, you are a fool. China will lie to cover up anything they fuck up, and it's just the way of the world. We don't want China destroyed. Because if China's destroyed,
you break China, you break us.
Yeah, you break the world economy.
Yeah.
And
okay, but let me counter argument. You break China, you don't break us. You break China, you hurt us.
Oh no,
we still have the natural resources to rebuild the infrastructure.
We don't have the existing infrastructure.
We have the natural resources to rebuild it.
Sniper, do you want your children to live and
you want them to be coal miners? You want them to be coal miners?
It may come to that.
Okay.
It may come to that.
But
the point is we can, if they all dropped dead, right? We do physically have the natural resources we need actually reboot ourselves here. It will hurt, but we would survive.
It won't hurt.
There are a lot of countries that would.
It would be fucking catastrophic. I think you are underestimating the decades that it will take to survive.
Oh yeah, it will suck.
Yeah, but I'm talking about the entire lifetime of your children. It will suck. It's
I don't know.
if you think
This country amazes you sometimes.
If we had to reboot ourselves, if three well-placed EMPs would put us so far back that 1930 would look good. I promise you that's true.
I think
I understand.
I think
that.
you're underestimating the cascade globally, not to mention nationally and
globally. That was actually the next part of my point. We can, with great difficulty, reboot ourselves. There are an awful lot of damn first world countries that cannot.
Right, and that is going to cascade back onto us, which is why
there is a high chance of that. Yes,
it is a guaranteed certainty.
We still have the aircraft carriers.
If we
think you're talking past each other is what I think is happening. You are correct. We would not be destroyed over the long term. Prospero is correct. The amount of suck that would occur over the short term is going to be
god awful monumental.
And as I said at the beginning of all this, we're talking about mitigating the amount of human suffering. All of, like I said, the domestic abuse, the crime, the poverty, all of these things. So you are both correct, technically. And I actually agree with Prospero because I know of specific instances of industries that it would take us at least 10 years to reboot because the Chinese have either because they have the economies of scale or they have some other advantage or the government has been subsidizing the sales in order to give them a long-term strategic advantage.
Yeah,
they just have a labor advantage.
We would not be in good shape. We would not be in good shape.
I know that. I'm not. That is literally not the argument. I don't know. Maybe I'm saying it in such a way where it flies under the radar, and that's why nobody's recognizing it. I'm not saying it will be pretty. It will be ugly. But we do have the land size and actual natural resources in abundance that we will eventually rebuild ourselves.
Okay.
And a lot of other places don't.
We could be self-sufficient.
You're probably right. But let me just take your point. How long would it take for us to accomplish that rebooting?
Oh, she's right. It would probably be close to a generation.
Close to one generation?
But I do.
No. I said your child's entire lifetime.
Yeah, I think you're talking 5 or 6 generations.
I think at that point, you underestimate the. Okay, we went from having screw all military to dominating dominating the Japanese.
No. Stop. Don't use history as your exemplar. Use now as your exemplar.
I still feel like
it would require the
more
will
spine in the rural people of this country than maybe you think there is left.
I think there is an enormous amount of spine. I don't think there are the resources to educate the spine to get us there. If you take down China, you take down the world. I'm not talking about just the United States. If Europe...
See, that's where it gets sticky because they don't have any resources really left.
Europe will collapse at a rate that is far faster than we will.
Oh, yeah.
And without Europe, I mean, if you look at the history of the United States... Without European trading partners, we would not be where we are at all.
I understand that.
That's why
I can give you an example. So it's not just about the abundance of natural resources that we have or the size of our labor force. It's about the institutional memory that we do not have in order to replace the things that are there. For example, we could not right now recreate the rocket engines that were used on the Saturn V rocket.
Yeah.
And the reason is because even though it's something that we made and we've got paper notes and all these other things, we literally do not have the know-how to make them the way that we used to make them. And there are a lot of things that are far more complicated than that we just literally do not know how to make. Now, you could argue that we could isolate China and keep South Korea, and that would mitigate nearly all of the problem. And we could play Risk all over the board, but it's kind of off topic, I'm afraid.
Yeah,
I know. Like I said, I was just making a larger point about we could,
I think
with great difficulty.
I think your children would not see it. That's all I'm saying.
It's possible.
Yeah, let's not do that. Let's not do any of this.
Yeah.
No, and I wasn't even saying that was going to happen. It just kind of struck me. Something one of them said just kind of struck me like I don't know. Maybe I still have a little bit more fundamental faith in what this country is capable of when they really have their ass to the wall.
I have plenty of faith in the country. I don't have plenty of faith in the institutions that exist now.
Oh no, you'd wind up losing. There would be a government reboot in this. You're not wrong.
Right, which means we're going to go Thomas Hobbes, and it's going to take.
We're going to
possibly yes.
Men in the Jungle, or I'm trying to think something you guys have read.
State of Nature.
Lord of the Flies. It's going to be almost Lord of the Flies. At first.
It could be,
and
it could be very
band
easily
together and into organizations, and you might have warlords for 7 or 8 generations. It's going to be nasty.
Well, you would revert. You're going to revert to basic feudalism, but it's
that's what I'm saying. Warlords, really, truly,
and that's not a future that I want to bequeath.
I understand that, and I'm not saying that. That wasn't.
Congratulations on taking a pandemic stream and making it more depressing. Thanks.
Thanks.
Well,
we did the impossible.
Can we move on to point 7? Because I don't want to flog this horse any longer.
Please,
we'll just be sad that based Liz is not here to tell us that we're all crazy. Most businesses have omnibus insurance policies or umbrella policies, which cover all sorts of things, but they explicitly do not cover acts of God or force majeure. I know this because I have such an insurance policy, and it definitely does not cover any of this. Even if you were to insure key people on a movie or executives for a company, most of those policies would not cover something like a pandemic. Would it be appropriate for the government to provide some kind of financial assistance to places or parts of the economy that were devastated by this? And I'll throw in an addendum. Would you change your mind about this if the damage was largely caused by government policies?
No.
So if the government enacts a policy to address the pandemic, which basically kills an industry, you don't think they should get any sort of help reestablishing themselves?
What you're talking about, Harry, because you're talking about the government as if it exists separate from the individuals that live in the nation. No.
Okay.
Because you're talking about destroying yourself. This is the thing about viewing the government as the thing apart from the individual citizen. We are the government. The government exists because we pay it to exist. We cease paying it to exist. It doesn't exist anymore. Except in theory. It's an apart view of government that has become endemic in American parlance.
Okay, you got there in the end. The facts on the ground is that's the way it's thought of. Whether that's the way it's supposed to be thought of or not is irrelevant. We can be right on that principle all day long. That's the way it's thought of.
And there is this thing called government. It's
That has gotten so big that people do not see themselves as even cogs in that machine anymore.
And the thing is that the government, without taxpayer funding, ceases to exist. What are they going to do? They're going to do it out of the goodness of their heart. This is the remove that
you're teasing with one of my favorite fantasies. Keep going.
Yeah,
don't stop.
No, but we're talking about this is the problem that we're facing right now with Bernie Bros and other people. And Harry, I am not accusing you of being.
Oh, I'm playing devil's advocate. I wouldn't have bailed out Chrysler either. I'm just trying to get a conversation going.
Yeah. This is the lack of sophistication in American education about what fucking government is, because even in Great Britain with a monarchy, government is the people. And this remove that has been, fucking deconstructionist, post-Marxist nitwits have managed to separate the citizen from viewing himself as part of the government of his own nation. And if you say, should the government pay for, what you're saying is, should I pay for? Should you pay for? Should Sniper or Skep pay for?
Thank you. Exactly right.
You're not wrong, but he was addressing. I do believe he was addressing the facts on the ground.
Those are the facts on the ground.
The thing is, and you and I and Skep and Harry and the however many people in YouTube may know this, but the other 285 million people in this country don't know this, which is why I amen to you when you said school sucks.
Well, there'll be disagreement.
Largely, I don't think it even comes down to where you're philosophically at on it, because you're philosophically, you're right. I don't think it even gets that far though. They can't. They still haven't recovered from 2008. We are 22 trillion in the hole.
Oh well,
they can't.
I mean, the money thing, oddly enough, and I may be dead wrong on this, but the money thing hardly enough matters, because money is fiat currency. People think it represents something hard. It doesn't. It's all a happy little fantasy. Your dollar bill is a unicorn dude.
Talk about your postmodernism.
Your dollar bill is a unicorn dude.
Okay, we've reached a kumbaya moment here of libertarians, and it sounds like we're all good with the creative destruction of the market just doing its job, and they will all go to work as metal workers or something else. All of those travel agents, we'll just have them do something else. Everything's fine.
Learn to code, man.
Yeah,
learn to code, exactly. I'm fine with that. I'm just trying to summarize. We're all in agreement, and we're just going to let creative destruction provide new opportunities for these people to do other things.
Harry, I don't think it's let. I don't think it's let. I literally don't see that they have the ability.
That's fine.
They might want to. I don't see it being possible.
Well, back to your point.
Somebody is going to propose this. Somebody is going to propose some sort of bailout or act to help the people who were affected by XYZ. And so that's why I brought this up, because I figured it was a question that was going to come up.
In all likelihood, due to modern ignorance. I mean, there is wow. Even Donald Trump will agree. Sure, we should do this. I mean, you'll completely collapse the economy one way or the other by these multiple crises that government is called upon to magically, with a money tree, fix. It's the slow chipping away of the, in quotes, liberal idealism of you can make the world what you want to make it if you believe hard enough. Clap if you believe in fairies. It's literally Tinkerbell economics. I'm not kidding you. That's exactly what it is. It is a fool's errand to think you can just take care of all these problems with magical government, which, by the way, is our money, and
taxation is theft.
In some cases, it's voluntary theft, and in others, it's not.
Theft is never voluntary, but anyway.
Okay.
Okay, look, fine.
Skep is right. Taxation is theft, but where you get into the nuance of the taxation is theft argument is: do you want to have a military to keep the Chinese from coming and taking all of our land, or the Russians, or whoever the bugaboo is this damn century? Yes, then you're going to have to deal with a little theft.
That's extortion, and most of us are willing to agree for social order extortion.
That's a whole different discussion. Let's stick to the.
Yes, thank you. I'm glad I didn't have to be the heavy.
No.
I'll be the asshole.
Let's go on to the next topic before we EFAP this thing into a 7-hour stream. So I'm trying to keep it moving. I'll be the bad guy.
Yeah, I'm actually probably going to have to duck out in like 10 minutes. So
I'm grateful. Please move it.
All right. So school policies. What do we want to do about schools? I pointed out a few things. I mean, first of all, if you want to spread a virus, by all means, have the kids go to school and lick windows and do whatever they do, because they all make each other sick, and then they bring it home and everybody else's gets sick. So I think probably the school closures kind of make sense to me, at least if they're used judiciously. People have been talking about telelearning as if this is a thing that all schools know how to do today. I'm kind of doubtful. I don't think a lot of schools are really set up for it. There are some great examples where it works and some other ones where it doesn't. But I just don't see that as being a universal solution for, having the kids be home for a month.
If you'd like, I can just head you completely off at the pass.
No, I want to finish really quickly.
Okay, go ahead.
So what we need to think about is what's the impact to the students in terms of some sort of protracted thing. Are we going to give them compulsory testing, and should there be compulsory vaccination? Now,
okay, now I'm going to head you off at the pass and say public schools are an abomination and fundamentally against the damn law.
Okay, yet still we have them and we have to worry about them.
Okay.
As far as
we're not going to abolish public schools today.
As far as your
ironically, this temporarily closing the schools might actually help the education of the kids in this damn country. But go ahead, Prospero.
No, it might. But go ahead, Prospero.
I was going to say, actually, there may be a silver lining there. You spoke of the infrastructure of teleeducation lacking.
It might push it.
Yeah. Which would not be a bad thing, because it would be a terrible thing with the state of our education system now. It might be an impetus to change. I'm cynical enough to think, nah, but it could, because there are a whole lot of, having taken education courses in graduate school, there are a whole lot of really useless people engaged in education.
Yes.
You have no idea.
I mean,
modernizing.
Most of them are in the
education
front
makes a lot of
office.
sense.
yeah, modernizing our public education system into something that, you know, there are homeschooled students that work online, and a lot of them, if they're bright, have finished high school curricula by the time they're 14 or 15 years old. If they're middling, 16 or 17, and if they're dumb as rocks, they haven't. Or circumstances get in the way. Anyway, I'm wandering the field. The public schools, everybody knows they're. If you want to pick a petri dish for humanity, just go to a school. That's a petri
Schools
dish.
and daycares.
That's a petri dish defined by walls. If it would speed teleeducation, there could be a positive from this.
I think you're right.
That's true. The other question, the compulsory testing. If you're gonna have public schools, you're gonna have to have compulsory testing in the schools.
I don't think
that's just the fact on the ground.
I don't think societally, children being out of school for 6 months, let's say, is necessarily going to harm us that much, because we all know that kids who do well in school tend to come from two-parent households who are pretty literate themselves, and they're not going to tolerate lunatics running through their house, and people will adapt, or communities will adapt. Groups of people that know that they are virus free will have the one-room schoolhouse again as a short term.
Yeah, well,
I laying off a year, depending on your age, and you're talking, Harry, about everybody being aware of why it's being done. I don't think colleges are going to be like, oh, you were off for an entire year when you were 15. You can't come in here. I think that is more surmountable than some of the effects of businesses being.
Yeah, I was actually getting ready to say the one argument against it is that at this point, the public schools have effectively become daycare to push mommy and daddy both out to a job.
Yes,
there would be massive economic disruption caused
I'm
by
not
it.
sure that they've become that functionally. They've become that in a practical sense. That's the function that they. It is a function that they serve. It's not necessarily the only driving function they exist. I mean, the schools do impart some information, and children go into school and they come out able to read, able to do basic arithmetic if they're lucky, and know a little bit about science, the world, and a whole bunch about gender studies.
Well, yeah, but I mean, there's still a fuck ton of stay-at-home moms too, or stay-at-home dads, depending on who's the major wage earner. So,
I was actually a major wage earner, and I was the stay-at-home dad because I could do system administration from my home.
Yeah.
But the fact of the matter is, on the lower end of the scale, there will be a large amount of economic disruption.
And there will be there'll be some. The sad part will be there'll be some kids out of that group that the year will matter more.
There's truth in that. But what would be actually interesting, thinking about the economics of this, is that situation might actually cause housing deflation, in that a lot of people, you'll have two choices:
housing deflation or housing
market deflation.
housing market going down in value, which is very different from deflation.
Well, no, I'm talking about deflation of the entire market.
So you're talking about, so it'll be
rent houses, everything.
It'll be a building boom.
No.
There too few dollars chasing too many houses is what you're saying.
No,
that's deflation.
Let me get there. Just
Okay.
let me get there.
Right.
I'm saying it stupidly, so just let me get there. So you have in the lower ends of the spectrum, you have too many people that will wind up not being able to work anymore because they've got to deal with their kids, that without their paycheck, they will not be able to pay the rent.
I gotcha. Okay.
So you will wind up with two choices from a market point of view. Either the market will have to deflate housing costs to let these people continue to have a place to live, or you're literally talking about kicking 100 million people out on the street, at which point everybody's real estate becomes worthless.
Well, but remember that, the market isn't a conscious entity that does things on its own. The market,
it seems that way sometimes, but no, it's not.
It's the reaction of economically rational people. So if people say, "Hey, I don't have a paycheck anymore. I can't pay you my paycheck. Mr. Landlord, can you loan me the money, or can you knock down my rent? If not, do you want to throw me out? You can evict me. It'll take a couple of months, and you can go through the cost to evict me." So there are some shock absorbers that will cause that to happen somewhat slowly. It won't be an immediate thing with lots of people thrown out onto the street.
There'll be a lot of behavioral shock absorbers too.
Yeah, exactly.
Because everybody will be impacted.
Yes.
The landlord himself will be impacted.
Yeah, actually, what you'll have is you'll have a decrease in the velocity of money in the economy, and as a result of that, you probably will have a deflating economy, and you'll have an increase in the strength of your currency.
Mm-hmm.
But I think wages might actually go up because the workforce is going to deflate, and only the more
you will have some paradoxical wage increase. Yes, you definitely.
You will have some.
Yes.
Well, it won't even be. I don't think it'll even be paradoxical, because when you have a very large labor force, you can keep wages lower, and you can engage in activities that aren't as profitable. If you have a smaller workforce, the existing people will be doing more profitable things on average, is what I'm trying to say.
Yeah, that's hard to call.
It just occurred to me. I know I've driven us way out into a field, but it just occurred to me.
Well, I know you're in a car outside in a very cold place, freezing to death. So pick your words carefully, Sniper. All right, so we're done with school policies. Let's talk about businesses. What can businesses do? And this is not academic for me, because I started this morning writing a plan for a business that's one of my customers, and I was sitting here thinking, "Oh, okay. So what are the priorities we're trying to juggle? Is it the viewing humans as sort of a capital asset in a very dispassionate sort of way, in which case, what the answer is, right? You have to continue the business, but you don't want to lose a lot of people in the process. And so you do your calculus based on that. But there's also the psychic costs of people, losing people that they've worked with, or having deaths in their family, and the absenteeism that happens over time. It takes a lot of time to train somebody to do most jobs. It's not unusual to take 6 months before somebody does any real useful work relative to what you're paying them. So what should businesses be doing, and how should that calculus look?
There's one other thing you haven't mentioned, and that is the heterogeneity of businesses. It's going to affect different businesses in different ways. It's
Clearly.
going to depend on whether or not they are labor intensive businesses or capital intensive. It's going to depend on literally what they do every day to make
Service
their money.
industry, yeah, service
A service
industry,
industry versus manufacturing,
Yeah.
right? Fabrication.
yeah.
Yeah, there's
The
a lot
service
of things going on.
industry is going to get hammered.
You can't really make. We can't really make. I don't think you can make any large statements about any of this stuff with that. It's such an unpredictable thing. The reason for that is it's hard to call the rapidity of certain effects and the scope of certain effects. We can speculate about them, but you can't really do much more than that.
Yeah, I mean, given a doomsday scenario of rapid infection,
Lots of businesses will simply close down.
Yep,
Particularly small businesses.
and that will be
People will subsist on savings for as long as they can, and eventually start hunting the neighbors for food.
yeah.
Isn't that fun?
I think because you're not looking at a year-long incubation period on this virus. There again, we don't have the good hard numbers to have any great idea of what this is going to do. It will differ between manufacturing and service.
Mm.
The service industry cannot telecommute. Manufacturing cannot telecommute. The insurance industry, the computer industry, a lot of the things that really are large employers, high dollar employers, and high dollar net contributors I'd encourage them to get systems in place ASAP for telecommute. Unfortunately, there's nothing to do for the others because they're human point-to-point interaction.
Yeah.
You can't telecommute to your job at McDonald's.
Right.
Now, speaking of a thing like McDonald's, I wouldn't be surprised if you see companies in service industry and manufacturing industries begin to be the largest consumers of things like masks, because it behooves them to keep as many of their employees from getting sick as possible.
Yeah, except the masks don't really work.
Yeah, I'm just going to say.
I think the whole
mask
mask thing is going to blow over.
The thing with masks is they're completely ineffective.
Yeah,
I think. But
they don't
the
cover
point
all
is,
the mucoid. Your eyes are as susceptible as your nose and mouth. So, if you're not wearing goggles and a mask,
the mask doesn't do anything.
Well, no,
the
masks are actually reversely effective. They don't protect you. They protect everybody else.
Yes.
Yeah.
Right. The simple paper masks that don't have the vent protect other people because they keep the droplets from being spread out.
Exactly.
Mm-hmm.
But the N95 masks with the convenient don't fog up your glasses exhale vent do nothing to protect anybody else.
Mm-hmm.
Yeah, because all you're doing is exhaling your droplets through the vent.
Mm-hmm.
And remember, this is a short-term problem. I mean, we're all expecting that there's going to be a vaccine next year. We are going to come out the other end of this thing. I don't think this is going to cause a lot of long-term changes in things. But I think it will accelerate things like the telelearning and the telecommuting, and we're going to see some changes. But I don't think the world's going to fundamentally be different a year from now.
I'm going to slightly disagree with you. I think this.
Please do.
I think this is much ado about nothing. I don't think this.
Gosh, I hope so.
I think
he's right
at all.
Yeah. I hope so.
I mean, I hope so.
And yet, I still have a plan to write.
That's just That's not to say that I haven't, salted away a few 100 pounds of rice and a whole bunch of sterile water, but that you know, uh, I really don't see this as being any worse than the Spanish flu would have been had we had modern uh,
Medicine.
modern antibiotics
Yeah.
to fight the secondary bacterial
Yep.
infections that killed all the people. I just don't see this thing as having a big enough mortality rate to change society much.
My greatest
I
concern.
believe you're correct in the first world.
My
Unfortunately, I think the developing world's going to have it worse.
Yeah,
well,
I was really talking about the United States. I'm sorry.
the developing world has
restricting my remarks to
the
only the
developing
United
world
States.
has everything worse. There could be a cholera outbreak tomorrow in India.
Or San Francisco.
Well, there are
Or
cholera there are cholera outbreaks in India all the time.
I know, but
They just know what to do about them.
Yeah, that's my point, because Western medicine has said, here's what you do.
The Ganges, if you go bathing in the Ganges, you're a fool.
Yeah, but
Well, there's still rabid dogs there too.
Yeah.
Sorry, go ahead, Prospero.
They're rabid raccoons in my neighborhood. It's the exigencies of life. I don't think our mortality rate is going to be that of the Spanish flu at all, unless this thing does something.
I don't think the case fatality rate is going to be any
case fatality rate. No. I think it's going to hover around 2.5.
Yeah, if that.
And that might be globally.
Yeah, in the United States, I don't think it'll even be 1%.
No, I don't think it will either, because even in East Jesus, Nebraska, and
they have antibiotics in East Jesus.
Yeah. What I hope is one of the first things the CDC did was alert antibiotic manufacturers to ramp up.
Well, let me tell you, they didn't have to.
Yeah, they did anyway, because
they didn't have to.
Well,
Those
the
guys
market
are
demands,
rocking and
right?
rolling. Yeah,
The market demands.
I promise you, the boys at Pfizer and Upjohn and Lilly and SmithKline are going hog wild right now.
Yeah, and you've got to also short sheet the bed of the people who are like, we get all our stuff from China.
Yeah.
No, we don't. No, we don't. There are critical medical supplies that we would never trust to the Chinese.
Oh, I have a story for you. I've actually been speaking with various people trying to gauge what the response is in the community. And I spoke with a surgical nurse here in Central California. It turns out recently, and this was not something that was published, I certainly didn't know about it, there was a major recall of a lot of protective equipment that was used in surgeries around the United States. It was all sourced in China, and it turned out that they didn't actually follow practices in a number of parts of the supply chain in terms of having the stuff all be sterile.
Mm-hmm.
So there was a major recall of that equipment a couple months ago. So
Yeah,
they are supplying critical parts of our chain is the point I'm making.
Well, they are. Are they the sole supplier?
That I do not know. I know that DuPont, in terms of making hazmat suits, they've been working overtime for the last few weeks trying to make as many as possible, just in case.
Yeah, and there may be a delayed response, and you might see high case fatality rate in the first month as it spreads through the United States because of supply chain issues. Those can be plugged. The one thing I will say about the first world is needs must usually works pretty well. If there is we contracted that stuff out to China 5 years ago. As long as you didn't burn the specs on the stuff, you can get it up to speed rather quickly. the emergency manufacturing nature that can occur. That's what truth be told, if we want to put the government, i.e. the taxpayer, on something, anything medical that we farmed out to China, try to ramp up redundancy.
Well, no argument there. They even make Macintosh computers in the United States because for exactly this reason.
Right.
The ones that the government gets don't come from China. They come from a place in California.
Yeah. And you can have emergency cost control. I mean, I don't really like that, but yes.
God. That's a kick in the groin to me. I'm still irritated at Nixon for doing that.
I said emergency.
I know, but yeah, man.
Yeah. The wage and price controls that Nixon used was just, that's how you knew he was a goddamned Rockefeller Republican.
I can't even pretend to play devil's advocate on that topic.
No, fuck him and fuck doing that. But that's what I mean by he was a Rockefeller Republican. He was not a Goldwater Republican, because Goldwater was like, God, what the fuck are you doing? It's just
scorched earth.
Yeah.
So may I run something up the flagpole for you here?
Please.
The argument has been made that the best thing we could do is just say, come at me, bro. Just let this thing hit, take the hit, whatever it is, and not completely tank our economy, because we may have more of a concern for human life than we possibly should in the final analysis.
Knowing what we
Your
know,
thoughts?
I think we should do that. Yes.
Yes, I agree. Because this life has no risk attitude that the woke crowd subscribes
to. Perfect. Yeah.
Yeah. The unicorn farmers, the Bernie bros, the oh my God, you hurt my feels. No. Come at me, bro. We'll handle it. There are enough adults in the room. Literally, there are. I mean, these school children who are whinging and whining aren't the bulk of society.
Well, we have an adult in the chat too, because Liz finally showed up. And you're right,
Yeah,
emergency cost controls are not a good idea.
No, I mean, you're right, because the government never institutes anything and then rolls it back. I think
income tax.
Yeah, no, you're right. I knew when I said it.
Temporary sales tax.
Yeah, temporary sales tax.
We're spitballing here. I'm not talking about my personal beliefs.
Okay.
I think we can handle this without becoming hysterical. And
don't forget Orange Man Bad.
I was going to say I went to a couple of stores today just out of curiosity, and we're already trying to get hysterical in certain ways.
Well, thank you, mainstream media. This is never let a crisis go to waste. This is a Zelensky playbook, and that's what pisses me off. We have had health crises in this country. We had a lot of people who suffered and died from tuberculosis. And we took some draconian measures in that regard. We had the HIV outbreak. God damn. I mean, if you have to be of a certain age to remember the beginnings of the moral relativism and the postmodern thought showed up then, didn't it, Scap?
Yep.
How dare you? How dare you restrict the personal liberty of individuals in the face of a virus that fucking kills?
Yep.
And even the small L libertarians were like, the fuck? Dude, seriously. I mean, shut up.
Yeah.
Reagan was tarred by the woke of their day.
Yeah,
Okay,
the
we've got a
good
late
thing in the
arrival,
case of
folks. Hold on,
Hey.
I'm gonna bring Liz in.
Yay!
I'm bringing different parts of the internet together tonight. Hi, Liz.
Hey,
Hey, Liz,
So
good
Liz
to
is
see
the
you.
most libertarian person I know, and that's saying a lot given the people in this chat.
Liz is the most libertarian person probably in 5 counties in Florida.
Probably.
I'd say
How are
the,
you tonight, Liz?
the entire state.
doing well, thanks. And you?
Makes
We're
makes
just
her kind of
hanging
a
out.
celebrity as far as I'm concerned.
She is.
In her own right, she very well should be.
Yeah.
She's weathered countless AA streams. I know that for sure.
Well,
That's a
let's
fact.
give her a chance to. You probably have some notes for us. Do you want to get caught up with us?
Well, I haven't been listening to the whole stream, so anything I say may be repeating something that was already said. I just became aware of the stream a little bit ago, but yeah, I could. What I would say is what I've heard a little bit so far. I agree with that. This is going to blow over. This is probably not going to be as bad as a lot of people are making it out to be, but it is going to be worse than some people are prepared for. I feel like I made a post on Twitter a while ago. I said I feel very privileged at this time to live in Florida. We prepare for hurricanes every single year. This is totally normal. So preparing for the coronavirus is not much different for me than preparing for hurricanes. Be prepared to possibly be stuck in your house without power or water. That way of thinking prepares you for something like this, where you may be stuck in your house and not be able to go out and get things. The possibility of contaminated water, I think, is pretty low. The probability of losing power is also very low. But just generally having food, and can you survive in your own home? Also, do you have everything ready if you were to have to evacuate? That's something we prepare for that probably is not going to be the case with the coronavirus. I would say I could imagine if there was an outbreak in the town next to you, let's say, and you're thinking, okay, that's going to spread to me fairly soon. I'm going to go 3 states over and stay with my sister or something. Then yes, are you prepared to pack up and leave at a moment's notice? Although again, in that case, it's not going to be a moment's notice. I guess all that to say, it is somewhat different, but this is a skill most people, I think, should have, preparing for catastrophe and being able to stay cool in it. And that's one thing Floridians are fairly good at. If you see all the memes of the Floridians out literally in the hurricane, having a hurricane party where you're just drinking beer on the streets, with 100-mile-per-hour winds. It's actually fun. I haven't been out there drinking beer, but yes, I have been out in the hurricanes just because it's fun. So being able to stay calm in a crisis, I think that is also key. So no, I guess I would say to everybody, know that yes, it could be very bad. It is possible, or at least in your area, that it could get very bad. So be prepared, but stay calm. It's going to blow over. It's going to be okay.
It's a hope for the best, prepare for the worst point of view. I was born in Florida, left when I was almost 8, but I've lived on the East Coast my entire life. So between nor'easters in New England, hurricanes from Virginia south, you do have, and I'm old. I'm an old lady. My parents were teenagers in the Depression. It's kind of easy to always kind of lay in certain supplies. My freezer usually is not empty. Meat goes on sale. I'm like, oh, I can use that. Canned goods, like Harry pointed out, trash bags, paper towels, toilet paper, water, the things we keep on hand in the event something goes wrong. And they don't go bad. You just use them if something doesn't go wrong. It's not people don't have to panic. It's just think about if you don't have power for 3 weeks, what are you going to do? Posit the scenario and work out what makes you comfortable. You don't have to be I built a bunker in order to be prepared.
I doubt that we're going to have serious power outages in anywhere other than
Yeah,
places like the major cities that currently have regular brownouts.
right.
Those places, yes, they're probably going to have power outages. But even, I think one of my sisters lived in a third world country in Nicaragua, actually, for about 10 or 15 years. And down there, they had issues with power because they were a communist country for a while and they were working their way out of it. And so what they would do is the power was turned off at night. So you knew you have power from this hour, this time to that time. So when you want to do laundry, when you want to do, oh, and water too. Water was also turned off. So if you want to do laundry, if you want to do your dishes, if you want to take a shower, if you want to watch television, anything you want to do has to be done between, from this time in the morning through this time at night, because then the power is going to be off outside of that. In my mind, that is the absolute worst that would happen here in America. Even if whole cities, if we had cities where a third of the population of the city was gone, you still wouldn't have total shutdown here in America, because most Americans tend to be self-motivated. Maybe not even most. Enough Americans tend to have that entrepreneurial spirit, even if they're not entrepreneurs themselves. They have the take charge mindset. Enough of us do that people with knowledge would step up and do what needs to be done.
Yeah, and also it would require every single person working for the power companies in states or regions to be gone in order to have a complete power shutdown.
And even if that happened, all that town would have to do is put out a call on the internet and say, we have nobody to run our power, and you would have at least a dozen people from surrounding cities come in, or from faraway states flying in, saying, I want to come and help.
Oh yeah, I mean, I had this discussion with somebody else the other day. Hurricane Isabel decided to mess Richmond, Virginia up pretty well. And 2 days later, we had a little tornado skip through town and mess up what wasn't messed up. And we were without power here for 11 days. And we had the ability to get out and get to Costco before they were completely out of water. Of course, you have emergency declarations that bring in water and that kind of thing. But it was annoying because we're accustomed to our lifestyle, but it was highly survivable. Our water pumps went down. We were on boil only. You just do it. And there was no massive outbreak of hysteria or looting violence or anything else. It was just, here we go.
I think the key there, and this is going to kind of have to be my parting thought because it's bedtime, but I think the key there is known entity versus non-known entity. And a lot of what we're talking about really comes down to the fact that there are entirely too many unknown variables because you just can't trust certain countries. And as the picture becomes clearer, Costco is going to start having water again. A lot of people, once they actually know the entity that they're into, they can deal with it. We deal with hurricanes, we deal with fires and earthquakes over in California, and tornadoes wipe out. Moore, Oklahoma got wiped out twice in 10 years. And everybody stepped up and helped everybody, and that's what we do. Every time California has the nasty fires, volunteer firefighters come from all over everywhere to try and help them.
Yeah, and my point about Isabel is the guys that hooked our power up after the 11 days were a combination of people from Pennsylvania and Georgia.
Oh yeah.
Because
we do still have enough fabric left of this country that we're fine in that sort of instance. And so a lot of what you see right now, like with the fact that you can't buy water from a Costco anywhere in this damn country, is just the unknown. And the media doing as we talked about earlier, the media doing a lot of it bleeds, it leads. that they don't need to be doing.
Panic reporting.
Give it a couple
yeah.
weeks, it's going to settle down. I really do think that. I am going to run and go to bed. This has been fun. I hope I've actually been
You're smarter than we are.
Dreams.
I hope I have been at least somewhat productive to the evening.
No, just thoroughly enjoyed talking with you.
It's been lovely meeting you, Sniper, and thank you.
Yeah.
Thank
totally.
you. See you later, Harry.
Good night, sir. Good night.
Bye.
Good night, Sniper.
Okay.
Yeah, I think we have a lot of manufactured hysteria right now. Just
I have a way to frame this question that might be useful for the discussion. If the world average of 30% of people get affected by this were to happen, right? And it all happened within the course of 2 months, you'd have 30% and then the people who would, stay home to take care of those people. How many businesses in the United States would just collapse if 50% of their workforce didn't show up for a month? I'm thinking not most of them. It would depend on if they were in key positions, of course.
it would depend on the nature of the business also.
Yeah.
Exactly.
What are they labor intensive or are they not?
Yeah. If you're manning the front desk at a hotel, you can work a 12-hour shift. It's ick, but you can do it. If you're
doing road construction, that's a whole different
yeah,
deal.
right. It entirely depends on the industry.
I think a better question would be what essential services would shut down if half their workforce went home, and what services or sectors would not be able to recover from a short-term or long-term shutdown.
Mm-hmm.
Because if you think about it, say my business is me. I have had employees over the years. I currently have no employees. If I was to get sick and be out for a week, my business would be shut down. Now, I would have to get payroll run, so I would have to force myself to work for that. But if I shut down for a week, I would have a lot of angry clients, but my business would survive. They would understand.
Mm-hmm.
So it would not be good for my business, but I would survive it, or my business would survive it. If a restaurant was to just close its doors for a week, they would survive. I have several clients who are in the medical industry, and quite often, and most of them will shut down for a week in December between Christmas and New Year's. Some of them shut down for the week of spring break so that they can spend time with their kids. So there are a lot of companies that actually can shut down entirely for a period of time, and it's not a big deal. Or, well, it would be a big deal financially, but their business would not go under, and nobody would die. If a dentist office closes for a month, nobody's going to die.
Right. It is intensely specific. There will be people who've been running too close to the margin will lose their businesses. People who have not longer established businesses that have backup plans,
Or just have a better business plan.
or have a better business, and may not.
Literally have a better positioned business.
And
They're going to be resistant to economic harm from this.
Mm-hmm.
And it's very once again heterogeneity.
Yeah,
It's everybody is going to be affected differently. And because of that, it makes the follow-on effects in society hard to predict. Also, because I think you would be faced with unpredictable and surprising shortages here and there from interactions that are very difficult to foresee.
But as you say, there are so many variables. Think about the law of unintended consequences. I'll give you an example. 2 dentist offices in town, half of their workforce gets sick, hypothetically, so they shut down entirely. Well, the other half of the employees, they are still healthy. They're still well. They would love to be able to work, but they can't. They have nothing because the office is shut down. What do? Now this other company that is urgently, that has to stay open, they're putting out a call and saying, hey, we will take anybody, even unskilled. We'll give you 1 day's worth of training, and we need you to help us here just for while our employees are out. So it could be that non-essential businesses shut down for a time, and essential businesses gain those employees to some degree. Now, of course, it's not going to work across the board because some things do require significant amounts of training, but it could be that they're able to move employees who have small amounts of training into more highly trained areas because they have some training, and then bring in new people to fill these other positions like manning the phones. So there are so many variables to consider.
Mhm.
It's just, there's so many things that will affect it.
This is, we're wargaming something that we only have limited data on. And that's another thing about, if this, then that, then that. This is the time to be thinking about it because the virus has just basically reached us. Or for all intents and purposes appears to.
Yeah, and by us you mean me.
Well, no, yes. This is all about you, Harry.
It's a lot less hypothetical.
I understand.
But you'll get your turn soon enough.
I understand. But what I'm saying is, for purposes of our discussion, because we all live in the U.S., it's just now reaching us, and it's, as we said earlier, we don't have the data from Indonesia, all of it, South Korea, Italy, places with larger caseload, to give us a better idea of the RO, to give us a better idea of the mortality, how many patients go critical versus uncomfortable and miserable, which is every flu.
I've felt like I've been coming down with something since December 1st. I took a bunch of expectorants, felt awful, didn't go into my customers, just went to meetings remotely because that's what you do when you're a responsible adult and you have the option to do that.
Mm-hmm.
For all I know, I could have had it for 60 days. I honestly don't know. But I do worry a little bit that people are going to overreact and cause a lot more suffering, unintended suffering as a result, because it's that calculus of the value of human life versus the quality of the lives of all the other people that come after it.
Mm-hmm. And it's the if it bleeds, it leads nature of the mainstream media and how people are already losing their shit about this before. I mean, they were losing it before the first case in the U.S. was identified. And
I don't think people are losing their shit over it. Honestly, most of the people I know are largely unfazed by it.
The majority, yes. Some of the spokes critters who reach a lot of people, if you know what I mean, blowholes like Brian Stelter.
Yeah, Stelter is a good example.
They freak out a bunch of people who don't need to be freaked out.
They do that every single year.
Yeah,
that's nothing new.
Yeah, cried wolf.
Yeah, and there is a lot of Chicken Little about this. A whole lot of Chicken Little about it. I think it's going to be a great deal of ado about something.
I don't think it's going to be pessimistic than that. I'm sorry. Go ahead, Liz.
I tend to be optimistic, to be honest. I don't think it's going to be anywhere near as bad as the worst case scenarios, which I feel like what we've been discussing. Oh, it could be this, it could be that. I feel like that's worst case scenarios. I don't think it's going to be that bad for the majority of the country. I think some cities.
Yep.
Yeah. Some cities are going to be hit bad.
Yep. It's why I said it's a much ado about something.
Mm-hmm.
Yeah. This was a particularly contagious flu, and we had a higher case fatality rate than last year, but I think on balance it's going to be crap in places like LA with large homeless populations, who won't seek care because they don't even know they're sick until they're halfway dead. But I
This
don't
may be
think.
the solution to the homeless problem.
Oh, stop it!
Like just thinking out loud here.
But
That's not an original thought, by the way. Scott.
yeah.
You're kidding.
You're not the
You
first
mean
person. You're not the first
I didn't
person to say
invent that thought. Are you kidding me?
Did Heinlein just
No.
wander into this?
I think that if it hits, but I think it is going to be different depending on where it hits. Yes, in LA or some places like that. But that's going to, you could have a lot of the homeless people falling ill and potentially dying, which try to imagine LA with bodies all over the place. That creates a tremendous health hazard beyond what they already have. And not to sound, callous towards the people who died, but that creates other problems that you
You
wouldn't
get some
think of.
potential bacteria vectors like cholera.
Yeah.
Yeah, it could be really, really bad for them.
Really very festive. Yeah.
Yeah.
I think about Florida. We have a lot of people here, and most of our population is older. So I think that if it spread in Florida, we would have a very high death rate, but it wouldn't be a huge effect on our economy because most of the people dying would be people who are already retired.
Yes.
And it wouldn't change the voter rolls at all.
Yeah. Cynically speaking,
Not in
though,
Chicago.
just realistically speaking, you're correct. The 2 cases in Florida so far are Manatee and Hillsborough, I think.
Yes, Manatee and Hillsborough. That's correct.
Yeah.
In other words, Tampa, basically.
Yeah.
So
And
if things do not proceed
Big
the
surprise.
way we expect them to, we may want to revisit this in the future. But let's just hope it all blows over and we don't have to worry about it. We're coming up on 2 hours and 45 minutes. Is there more that needs to be said?
I can't.
Probably not much more. Is there still the 3-hour limit on stream?
I have no
No.
idea. I think it's 4.
There
maybe.
used to be, YouTube used to limit streams years ago to 3 hours. I didn't know if
They might have different limits depending on how many subscribers you have, but I mean, there are people who will do 12-hour streams.
Okay,
no,
all right,
yeah.
good to know.
Yeah.
I didn't know. Like I said, I streams this long are this is probably the longest stream I've ever been on.
Monkey streamed for 15 straight hours.
I was on with him for a couple of hours.
Yeah, when Satsu's baby was coming. So it was the Lords of the Night extravaganza because Squishy went into labor.
Yeah.
Satsu didn't shut down the stream and they continued to stream for about 15 hours. So yeah, no.
Well, I know you two are streamed for 2 hours before you even came on here.
Correct.
My headphones are welded to my head. I'm good.
My earbuds have crawled inside my ears.
So the nicest thing I can do is let's just wrap up. Does anybody have any
God's
parting
sake, let me
comments
go to
before
bed.
I kill this thing?
What is that supposed to be my parting comment?
I'll go with a parting comment, and it is very much what Liz said. That I think this is much ado about maybe nothing, possibly even nothing, but more likely something. But it's not going to be anywhere near the anathema that, and there's also a lot of political nonsense going on, particularly by the left, trying to make this the worst possible situation because there's nothing they like better than to shake loose a bunch of money in an emergency fund and virtue signal to everyone how responsible they are, particularly with an election coming up, and they'll want to hit Trump over the head with this and say how irresponsible he was, how he did nothing in the face of this hideous virus, which is modern day plague and all this kind of stuff. And I think it's a bit silly. We don't know how big it's going to be, but I don't think it's going to be much bigger than many other flus we face. So that's my story, and I'm sticking to it.
Mm-hmm.
Okay, Prospero.
I agree with what Skep said. I think they are creating the tempest in teacup. They've found a niche story that terrifies people, because one thing people who view the world as a whole, I guess I should call them globalists, they think that China is exactly the same as Springfield, Illinois, and that what happens there is the same as what happens here. And that's not the case. Population density is different. Exposure rate is entirely different. And big cities, yeah, maybe. And it's just hysteria cooked up to find a weapon, a political weapon, and it's clear it's political, because you have purported journalists and their followers saying, hey, a Trump rally would be a great place to spread this. I mean, that kind of stuff has been on Twitter. And I wouldn't complain if. And so those signs and the ease with which people who are supposedly verified are doing that kind of thing makes me think a lot of this is ginned up. Just a Linsky playbook.
Be funny if they changed the term verified to certified, because then we could at least make jokes about them.
Certified.
Their certified status.
Yeah, you're a certified asshole.
Certified something.
Yeah.
You have anything to add, Liz?
I think that the one thing we should be concerned about, it kind of periphery issue in all of this, is watch for new legislation that people will try to pass, justifying it by this. And things like compulsory vaccinations, things like price controls. These things might sound good in the short term and say, oh, this is excellent to help us through this emergency. They never go away.
Yeah, this temporary measure will go away as soon as unicorns are spotted flying over the sun.
Yeah. When you hear your friends and family, when you hear politicians or people in the local area saying, we need to pass a law against this, or, oh, we need to put this rule in place, I would say stand against it. Even if it sounds good, stop and say, nope, don't do this. Don't act out of panic.
Liz, I like the way you think.
Oh, no. If you, how do you not know Liz? Have you not been watching?
I don't know. I for some reason we missed each other, but two libertarians passing in the night and all that sort of thing. But there you go.
Yeah, it's
how fun.
It's
good for you, Liz. Excellent analysis and excellent recommendation. Good on you.
Yeah, look out for another Patriot Act.
Okay, so I'm gonna wrap up by just saying that
we both
even though
uniform agreement of
yes, even though everything's going to be okay, there are going to be some people that probably are going to need a little extra help. If you know people who are at risk, just make sure they follow the guidelines about hand washing and maybe staying out of the way, because there are people that are fragile and we don't want them to suffer needlessly. So take care of the people that you care about, drink a lot of water, get plenty of sleep, and thanks for listening. Good night, everybody.
Good night, everybody.
Night.
Good night.